Goyal, and it is indeed a pleasure to have you all over here in this theme session, One Earth, One Health Digital Portal Showcase. As we begin, I would like to invite over here our session chair, Dr. V.K. Paul, member, Niti Aayog, Government of India. Can we please have a huge round of applause while he walks towards the stage? Welcome, sir. I would now request and invite Ms. V. Hekali Zihmumami, Additional Secretary, Ministry of Health and Family Welfare, Government of India. Welcome, ma'am. I would also request Ms. Nidhi Kesarwani, Director, Ministry of Health and Family Welfare, Government of India, to please join us. And joining dignitaries, we have Mr. Kiran Vaska, Director, National Health Authority, Government of India. A warm welcome to all the dignitaries. To begin, I would now request and invite Dr. V.K. Paul to please join us for the opening remarks.
Namaste, good afternoon, dignitaries on the dais, excellencies, guests, brothers and sisters. Very warm welcome to this session where, in the context of One Earth, One Health, we would like to present to you a systematic effort to showcase and to share with you our capabilities, our possibilities, our resources, and indeed our deep invite to you to please come to India, heal in India. We also would showcase our capabilities in providing healthcare professionals so that they play a role not only in India to advance health, but also in the world as healers and also as ambassadors of our great nation. India offers quality care at an affordable cost. India offers not only medical care, but also wellness, equanimity, and rejuvenation. Wellness, equanimity, and rejuvenation, because as the World Health Organization states, health is not just an absence of disease, but a complete state of physical, mental, and spiritual well-being. A complete state of physical, mental, and spiritual well-being. And in doing so, India offers choice of care models and systems. The most modern, Yoga, Ayurveda, Siddha, Unani, homeopathy, Sova Rigpa. And indeed, we offer alignment of these systems through integrative medicine and integrative healthcare approach. Furthermore, India offers healthcare with our legendary, affectionate hospitality. We offer an ethos of care driven by family values, because we believe whole world is one family, Vasudhaiva Kutumbakam. So we care for the sick child, sick woman, the frail and the elderly, from any part of the world, any part of our great humanity on this planet. And we offer it with a blend of scientific principles coupled with warm touch. Today, we would also like to present to you our possibilities in the sphere of providing health professionals to other nations. Nurses, pharmacists, dietitians, physiotherapists, technicians, psychologists, and other allied professionals. In order to do so, we will present to you digital windows to these two worlds. I'd like to request you to share your ideas and thoughts how we can create an ecosystem in our nation to advance the cause of health for humanity in the largest global infinite sense. We bring to you the two digital portals. We'll describe them to you, and we look forward to a vibrant interaction. Thank you very much for being here, and very, very warm welcome once again. Namaste, Jai Hind.
Thank you so much for those words of welcome, motivation, and encouragement. I'm sure we all are looking forward to the session. I would now request and invite Ms. V. Hekali Zimomami, Additional Secretary, Ministry of Health and Family Welfare, to please join us for her address.
Dr. V.K. Paul, Honorable Member Niti Aayog, colleagues from the Ministry, Ms. Nidhi Kesarwani, Director in the Ministry of Health and Family Welfare, Kiran Vaska, Director, National Health Authority, Government of India, distinguished delegates, esteemed invitees from the industry, and ladies and gentlemen, a very good afternoon to all of you. In recent times, the world has witnessed unprecedented disruptions to healthcare systems, economies, and societies due to the global health crisis. The COVID-19 pandemic has served as a wake-up call, emphasizing the importance of global collaboration and synergy in facing such challenges. India's G20 presidency has been carried forward with the vision of One Earth, One Family, One Future, which elucidates the Indian traditional belief of considering the world as one family and instilling the value of unity and oneness. It also emphasizes the interconnectedness of the world, which was felt during the COVID-19 pandemic, and highlights the importance of working together to address global challenges. As we strive to build resilient and responsive healthcare systems, India believes in the principle of One Earth, One Health, which promotes collaboration, collaborative healthcare efforts across borders, encouraging cooperation, knowledge sharing, and capacity building among countries and healthcare providers. It fosters the idea of global partnerships and collaborations to improve healthcare outcomes for patients, facilitate knowledge exchange, and promote best practices in patient care. Today, I am pleased to introduce to you a groundbreaking initiative from India that aligns with this very principle, the Advantage Healthcare India Heal in India portal, a one-step digital destination on medical value travel. This pioneering platform aims to bring together the best of our healthcare services and the warmth of Indian hospitality for international patients seeking medical treatments abroad. The portal is designed to be a comprehensive, user-friendly, and multilingual interface that caters to the needs of patients from all corners of the globe. This exemplifies India's commitment to leveraging technology for enhancing accessibility, affordability, and quality in healthcare services. As we introduce this medical value travel portal, we extend our invitation to all nations to collaborate with us in promoting medical value travel as a means to achieve the overarching goal of One Earth, One Health, one future. By coming together and sharing best practices, we can create a global healthcare ecosystem that is resilient, inclusive, and sustainable. In conclusion, I extend my gratitude to the esteemed delegates for this platform to share our vision for the Advantage Healthcare India Heal in India portal. Let us unite our efforts to ensure a happier and a healthier future for all of humanity. Thank you and Jai Hind.
Thank you so much, ma'am. And since we've heard so much about the Medical Value Travel Portal, let's witness the showcasing of it. And I would now request Ms. Nidhi Kesarwani, the Director, Ministry of Health and Family Welfare, Government of India, to please showcase the portal.
Thank you. Respected Dr. Paul, Honorable Member Niti Aayog, Ms. Hikali Zimomi, Additional Secretary, Ministry of Health, my colleague Dr. Kiran from Ministry of Health, ladies and gentlemen, the delegates, officials and the invitees. I'll be deliberating upon a presentation, a small presentation to set the context as to what do we mean when we say One Earth, One Health, Advantage Healthcare India, and how we can use digital technology to deliver this concept and this principle to the public in general. Today, when we can see what is medical value travel and the economic imperatives of it, today global market, as we can see here, has risen to almost 193 billion and growing at an exceptionally high rate of 29% in the global medical value travel. And India in this has risen from $6 billion to 13 billion today, which is for the forecast till 2026. And why, when we say India, why it should be for Advantage Health, what India brings on the platter? When we see our trained medical practitioners, in India, we have almost 1.3 million allopathic doctors, more than 800,000 Ayush doctors, 3.4 million nurses and ANMs, and almost 0.3 million dentists, which are available, which are trained, skilled, and certified professionals and have fluent knowledge of English. India is also a home to traditional medicine systems where therapeutic and wellness systems are developed and used in our day-to-day lives and even in our health systems to ensure to provide a wellness approach towards a particular individual. And various other streams like Ayurveda, Yoga, Siddha, Unani, homeopathy and naturopathy are prevalent in India. The quality of the treatment is very, very important. In India today, we have more than 40 JCI or Joint Commission International Accredited Hospitals, more than 1600 National Accreditation Board for Hospital accredited hospitals which are available and now which are here with our portal aligned with it. Another important aspect is when any citizen or any patient looks for a medical treatment outside their country or even within their country, affordability is one of the main constraints which come so that the out-of-pocket expenditure is minimized to but. So here India provides a quality treatment which is 2 to 3 times lower, to the extent that it is so cost effective, it is almost 90% cheaper in other countries in terms of cardiology, some of the cardiology and orthopedics treatment. India also has state-of-the-art infrastructure. In private sector, there are many hospital chains and institutions which are established and which are also specialized, and super specialty hospitals are available. Even in the government sector also, such hospitals are today up and running, and which have medical, both therapeutics and diagnostics, everything is available. The fast track appointments are there because of the availability of sufficient amount of manpower. Today, the appointment time or the turnaround time to seek an appointment is very limited. When we see the medical tourism index today, India is amongst the top 10 countries in global tourism index because of its environment which is provides, the medical industry which is facilitated, and the quality. Here, the affordability in the pictorial format, when we compare it with other countries, we can see how affordable Indian treatment, Indian medical system is in terms of their counterparts in nearby countries. Various cities, it is not just that there is one particular city which provides such type of medical treatments, but it is spread across, it's pan-India in nature in various states, right from south to north and east to west. The collaborative efforts, when we see who are the stakeholders in this medical value travel in India, we see central government hospitals which are there and central government ministries which will be involved, whether it is tourism ministry, Ministry of Health, Ministry of Ayush, Ministry of Civil Aviation, because when one patient thinks about coming to a particular country, these particular stakeholders get involved, the NABH accreditation. So the digital portal which we'll be showcasing is roped in all the features and the processes initiated by these particular stakeholders. The commercial players, especially the medical service providers, the insurance providers, the hospitals and the diagnostic centers, and also the industry associations in terms of logistic service providers, which can be facilitators, the airlines, the tour operators and all. They are all brought in this one platform for facilitation. So when we try to unlock this world-class care, we do need a particular one single stop shop, a single window where we can have all these facilities. So this is where the Advantage Healthcare India portal comes into play. It's been created by Ministry of Health, and it facilitates both the workforce mobility and also the patient mobility. I will talk about the patient mobility feature, and my colleague here, Kiran, will talk about the workforce mobility. So this has all the search functionalities in this portal, which a patient journey from end to end, right from the point when patient thinks about going for a particular treatment, to enlisting it, to physically getting all the clearances to go to that particular country, and also to reach the particular destination, get the treatments, and return back, and also the post-op follow-ups. The post-treatment follow-ups are all brought in one. It has, so there are various features. The teleconsultations are also being facilitated in this. It also tracks it also facilitates various hospitals, various facilitators, the insurance providers in addition. So this one platform will provide us various allopathic and Ayush hospitals across the India. It has more than 350 hospitals right now aligned with it, filling the data and their doctors and various specialities and the diagnostic treatments and the treatments available. And also it covers all the states, almost 23 states, and cuts across almost 98 cities and is expanding further. The most critical point when we look from any country's perspective and from the government's perspective is, if my citizen is going to another country, how easily the person is getting facilitated? Are there any hiccups, or the person is not getting in contact with some touts or any imposters, and gets a proper quality treatment for whatever, for the money which they are investing. So here we capture the end-to-end patient facilitation portal, right from, as already explained, from various features, right, even the visa clearances, medical appointments, teleconsultations, reports and everything. This is the personalized dashboard which will give a track to the patient journey. We'll give a demo of that particular portal live over here. So I will skip and I will come to the portal here, to the portal just in a few slides here. So this, between the facilitator and the patient as well, a seamless coordination is very, very important. And here in this portal, we have NABH accredited facilitators onboarded, so they can ensure that the proper facilitation and processes are being followed. A personalized journey and for the country dashboard is very, very important here, which we will facilitate once there is we have a process of signing a letter of intent between Ministry of Health and the concerned country. So a personalized dashboard and the access will be provided in this portal to the particular country focal point, so they can see from their login ID which department. They can even be authorized to create various departments, because every country has a different system, and they can create the patient credentials, and then the facilitators can be mapped and journey will begin, and the country can see how many patients are going in which system, which city, for which particular treatment they are going. So these facilities and features will be available. And hospital dashboard is also available here, that every hospital will be able to see their patient traffic, profiles, the treatment profiles, and other reports and documentations as well. And a way forward will be that here we are saying that medical tourism is being taken up by the private sector and by the private initiatives. It is now long that government should step in and create an enabling environment for all the stakeholders, so that that access to health and affordable health reaches each and every citizen of the globe under our policy of One Earth, One Health. And the cooperation of private sector is very, very important and critical to make this a success. And so that we also ensure that the grievance redressal mechanisms and everything is in place, and cross-border partnerships, that the boundaries are dissolved, and we have pre-operative consultancies and various rehabilitation services. They take no boundaries to reach. So thank you. I will now request my technical team to go to the portal here. Yeah. So this is advantagehealthcareindia.gov.in portal, which you have seen being launched right now by Honorable Minister of Health. So here in this portal, this is the landing page, and the patient mobility site, when we click, this is the main landing page of patient mobility here. And when we see here, you can search in terms of hospitals, you can search for doctors, you can search for treatments and various facilitators and various specialities in focus. It has both modern as well as the traditional treatment components in it. Please come down. We can have the facilitator list, the patient dashboards, and even the testimonials of various patients who have used this portal till now and can see how they have been benefited and facilitated by this. So for example, we can just see a testimonial from any of the Bangladesh, for example, we've just taken. This is all live. You are seeing it live right now. So this is the testimonial from the patient, that how easy it was for the person to reach India using this portal and get the treatment done. Yeah. Now we can see the most critical element here would be the patient journey. So when we see the patient, we can just go to the patient login. Here is the patient login. So the moment we will log in over here, it will ask for a mobile number, and an OTP will be sent to that particular mobile, so that it is restricted use. It cannot, the data of that patient is saved, and this is the main landing page for the patient. So once, please click on the patient. Yeah, so this is the dashboard when we see. So from here you can see the timelines for the patient to apply and also to go through. So patient here can search where the person wants to go. So if suppose I am a patient and I want to go through to specialities, I want to just go for some treatment I want to look for, I can search on the dashboard. For example, I pick up cardiology and a CABG treatment if I pick up. And we can then filter on the left hand side. You can see various filters options are there, and I just want to be in Gurgaon, so I can click the city in Gurgaon, and if I know a hospital, I can click on the hospital as well. For example, if we click on Medanta, so then we can see here the doctors who provide this facilitation and their profiles, and then we can we can select any doctor, and once we continue, I can select all the doctors also. So because I don't know which doctor will be available to give me appointment, I can then upload my reports over here. I have been already going through some consultations in my original country. So one can upload all the reports over here and will get this message here. Thank you for uploading your reports. And once these reports are uploaded, these reports will go to all those doctors whom I have selected. And then doctor will log in from their portal, will see the reports, and will be in a position to revert back on that. Apart from this, it will also go to the concerned facilitators. I can also use this portal for teleconsultation with the doctor. Before going, I would like to have some teleconsultations with multiple doctors, and also I would like to have some queries also in terms. So when we go to, please move on to the facilitators. So once these reports are uploaded, it will be guided to a facilitator who will log in and can then see which patients are being referred to to the facilitator, and can then select the patient and see the profile of the patient. If any documents are incomplete, can communicate through this portal itself, and then once the documents are complete, can initiate the process of getting necessary clearances. Similarly, most important here would be the country dashboards. So when we see the country dashboards for a particular country, once a login ID is given, these are the features which will be available. How many patients have been sent to a country, in which sector they have been sent, government or private, which cities most of the patients are going, what is the gender profile, age profile, and in which particular treatment most of the patients are going. A data which can help the countries as well to create and identify the areas which are missing in terms of specialities or super specialities, and then take actions. And this dashboards and the input points can also be customized for country to country once the LOIs are signed. So this is what we have a portal available with us. Now, thank you so much for giving me this opportunity, and as one of the doors to ensure that how digital technology can help us to break the boundaries, dilute the borders, and ensure that health, affordable and accessible health coverage reaches everyone on this globe. Thank you.
Thank you so much, ma'am, for taking us through the portal and sharing the various advantages as well as the facilities that are being provided to the healthcare segment over here. Thank you so much once again. Moving ahead, I would now request and invite Mr. Kiran Vaska, the Director, National Health Authority, Government of India, to please join us for his address.
Thank you. Dr. V.K. Paul, sir, Member Health Niti Ayog, Hekali Simomi ma'am, Additional Secretary Ministry of Health and Family Welfare, Nidhi Kesarwani ji, Director Ministry of Health and Family Welfare, and all the invitees and participants of this event from different parts of the world. While when we were talking about One Earth, One Health, one objective was to open up doors of our country, inviting patients from all across the world to take advantage of the services and the quality of and our hospitality here in India. At the same time, India, with its objective of serving the entire world with the whole idea of One Earth, One Health, One Family, we are also open to sending our doctors, our healthcare professionals to your countries to provide the services over there. So, for example, in the software industry, we export software. At the same time, our software professionals across the world have made a mark in different countries. Similarly, we export generic medicines. We are one of the largest exporters. At the same time, we would also want to send our professionals to your countries to provide the services over there. So, but then, how do you make it more seamless? How do we make it more easier for you to find who is available and for our professionals to find where opportunities are available? So, with this objective, the idea of promoting global healthcare workforce mobility is being taken up through use of information technology and bringing all stakeholders together so that one can easily discover opportunities, and those with opportunities and employers can easily discover professionals who are interested to come and work with them. So I'll briefly run through a small presentation giving you an idea of what this portal is about, and then we will just have a small run through of the portal itself. Next slide, please. Oh, right, let me check. Yeah. So the WHO report 2020 says that global spending on health is continuously increasing, and as of 2018, it stands at 8.3 trillion. It will only increase. And similarly, as the effects of COVID-19 go down, global wellness economy is also projected for an annual growth of 9.9%, reaching nearly $7 trillion by 2025. However, healthcare not only needs technology and finances, but it also needs a human touch. You ultimately need a doctor, a nurse, a technician to do the job. And the availability of sufficient number of skilled healthcare workers is actually central to the success of any health system. So even during COVID-19, the world realized that this shortage of healthcare professionals is a major issue, and many countries in fact decided to ensure that existing work authorization of professionals working in their countries are either extended, they either give them temporary restricted licenses, or they either fast track this. Now, how do we make this a more sustainable thing? How do we break these barriers and make sure that this global gap of professionals that is projected again by WHO, that by 2030 we will have a shortage of 15 million healthcare professionals across the world, and it affects the entire world, be it the Western Pacific region, the European region, the Americas, or anywhere. So how do we make sure that this shortage is addressed? And at the same time, in India, the healthcare workforce, existing workforce, is not only good from a quality point of view, we are also continuously increasing the numbers. These numbers have already been shown in the presentation by my colleague earlier. Just to reiterate, the number of doctors, nurses, ANMs, and other allied healthcare professionals in our country, these are the existing ones. And I'm happy to report that we have literally doubled the number of professionals we create annually, be it doctors or specialist doctors or nurses. So as we speak, more and more healthcare professionals are being produced in our country, who are not only serving in India, but are also willing to come out and serve in other countries as well. At the same time, India's strength in traditional medicine is well known, and all these different kinds of systems of medicine in the traditional medicine, the Ayurveda, Yoga, Naturopathy, Unani, Siddha, the number of professionals, and mainly the emphasis of government in promoting wellness in a holistic manner is actually giving impetus to the traditional medicine as well. So we have a large number of professionals of traditional medicine ready to come out and share this knowledge and give that experience to the rest of the world. So now, Indian professionals are already serving in different parts of the world, and especially in the OECD region, we are number one in providing doctors and number two in providing nurses. So there is already a flow happening, but then how do we make it much more simpler, much more smoother, and probably increase this further? So with this objective, the Healthcare Workforce Mobility Portal has been started, and the idea is to promote healthcare workforce mobility by offering partnerships with relevant stakeholders, and also to make sure that existing barriers or existing issues of trust and other grievances are well addressed, so that the professionals and the recruiters and employers can come onto one platform, interact with each other, find each other, and professionals find a place to work, a verified place to work, and recruiters and employers find qualified professionals who are authorized to work outside the country. So the benefits of such a portal are obvious. We would have global accessibility, global discoverability. One is you can discover professionals, and the professionals can discover opportunities outside the country. Availability. One can always know how many doctors or how many professionals are available at any point in time, and what duration. Some may be available immediately, some may be available a few months from now, so that information will be available transparently, and the outreach will be seamless because all this is happening through a single portal. And then it also addresses certain gaps that were existing in this sphere. One is about the gaps in transparency, about the aspirant healthcare professionals should know what is available outside. The job of, and then the recruiting agents or the employers should know whether the person who is coming to serve in our country is actually qualified or not. At the same time, trust. By trust we mean having single sources of truth so that everybody can refer to those information to make sure that whoever is participating in this whole process is a verified entity. And then accessibility. Like I said, by you making a single portal, giving it various means of accessing, one can actually address the issues of dependency on certain agents or dependency or lack of information, which makes things much more simpler. So who are the stakeholders here? On one hand, we have healthcare professionals. On the other hand, we have foreign employers. And all this is facilitated through different ministries of Government of India, our professional councils, and then recruitment agencies which are certified by the Ministry of External Affairs. And one important aspect of whole thing is what we call the healthcare professional registry. When we say that we are willing to send healthcare professionals from our country to your country, every one of them is verified at an individual level and also at a professional level. Whatever courses, whatever certification, whatever training that person has undertaken, all this is verified, and we have created one single national registry called the Healthcare Professional Registry that actually ensures that everybody who is participating in this mobility is actually a trusted, is actually a verified professional. So therefore, you as a receiving country would always be assured that whoever is coming through this channel is actually a genuine person, is a genuine professional. So that is one very important aspect of this whole effort. And then the healthcare workforce mobility portal has different functionalities depending on who is the stakeholder. If he's a professional, he can search for opportunities, track their application, withdraw their application at any time, update their details if they have acquired a new certification, etc. For a foreign employer, they can look for professionals who are interested to coming and working in their countries, follow up with the professionals, track the applications, and then update their own details and their own opportunities. Similarly, the recruiters, the agents that are certified by the Ministry of External Affairs also can play the role of facilitation. And then government level nodal officers will be overseeing this entire activity to make sure that grievances are addressed in time, overall progress is good, and if they, in case, I mean, there will be more and more information as to which country needs more and more, where there are more opportunities, so that if there is any requirement of any direct engagement with those stakeholders, that is also possible at the government level. So, and then the application can actually be tracked at various stages, right from initiation all the way till starting of employment, and in between there will be other stages such as verification, employer connection, pre-departure orientation, so that when the professional comes to your country, they are not confused. They are very clear as to where to go, how they start to work, and they are ready for available for work from the day they enter your countries. So with this, I will end my presentation, and I'll request my technical team to switch over to the portal so that we can just briefly show you what this portal looks like, because it is live and just has been inaugurated by the Honorable Minister in the other meeting. So broadly, this is how the portal looks like, and as usual, the Advantage Healthcare India is going to be the anchor portal through which patient mobility and workforce mobility portals could be accessed. Please click on the workforce mobility. So here, the very first page gives anybody who is accessing the page to search for professionals, either by professional. Click on advanced search, please. So in the advanced stage page, you can see, you can search for professionals who want to go to a particular country by country of interest. You can search by professional type. You can search by speciality. You can search by experience of the professional, and also availability, because a professional might be you may need some doctors, some professionals 3 months from now, 6 months from now. You can actually search using that parameter, or you can simply write in the text box. Let's say you are from Japan and you want to look for professionals who want to go to Japan. You simply hit Japan and you click search. It will list out all those professionals who are interested in going and serving in Japan. Similarly, you can search for a professional type, and then you have, for the professional himself, he or she can directly look at the directory of recruiting agents, where you can go to the recruiting agents. So they can actually find out who all are the recruiting agents and for which country, and then they can connect to them asking them if there are any opportunities for for that particular country. Instead, some professionals can directly choose to connect with the employers, where the employers themselves can present themselves, and there they can publish their opportunities so that the professional can directly speak to the employers. Now we will, and this overall thing is monitored through a dashboard, both by the government agencies and also by the different stakeholders, so that one is always in the know of what is really happening to these professionals, how many applications are coming, how many recruiters are available, what is happening, how many employment opportunities are available, how many have actually succeeded in actually finding an employment, and then what are the issues, if any, that need to be resolved. So we'll just try to also log in as a professional and also show you what it looks like for a professional once they log in. So there are different means, because these are Indian professionals, we also make sure that they can log in using a mobile number or an Aadhaar OTP or even a normal password. So on the left hand side, as you can see, there is a menu where here the professional can look for, her own dashboard, where they can see how many applications they have initiated, what is the different stage, and as you can see, all her applications are bucketed into different stages. So I may have applied in 6 different jobs. Maybe one of them, a few of them, the employer got connected. In some cases, verification is pending. In some cases, that is done. There's a pre-departure orientation happening. In some cases, the visa or work permit is currently under process. And then in some cases, the entire work is done and they are just ready for departure. And then finally, once the employment starts, we also want to make sure that once the professional goes to a different country, the professional also is aware that there is somebody back in India who is looking after them, and in case of any issue, they can get back and claim or connect with the country people here. And then from here also they can directly connect to a particular recruiter, where they can, let's say, write to a particular, select a recruiter of their choice, and there will be a two-way communication between the professional and the recruiter. So they simply say, I want to apply for so and so job, and then they upload the required documents along with it. And now that is now visible as a application that has been initiated. And on the recruiter side, we will show you what happens on the recruiter side to whom this application has gone. So these recruiters are agents who are verified by the Ministry of External Affairs, and they are responsible for facilitating the movement of these professionals. Now, as you can see, on 17/8 at 1:32, there has been one application from Lata Gupta to this particular recruiter saying that I am interested in an opportunity. Now he or the recruiting agency can now respond back to that query saying whatever, let's say they have found an opportunity, they can say we have connected with you with an employer, can you please share your work details or any other information, and then they submit it. Now this message is now visible back to the professional, where they can see that employer connected, they just got a response. So this way, the entire communication can be tracked here, including uploading documents, and then this provides that comfort and that confidence that whatever is happening through verified entities and verified professionals. And then we can then look at the history of what conversation has happened between the two, what documents were shared, what was the offer given, etc., so that there is an assurance that once an offer is given, it is recorded somewhere, and there is the nodal officer at the government level who can support in case of any issue. So, and then internally the dashboard and the external dashboard would be what the nodal officers would be using to track these applications. So overall, the objective of the portal is to bring all these stakeholders together onto one single platform, make things seamless and easy for you to find prospective professionals who can work in your countries, and for our professionals to find opportunities in your respective countries. So with that, we close the demo, and thank you very much for your time and attention.
Thank you so much, sir. I'm sure that this was quite an insightful session over here. Moving ahead now, we are taking up some questions. As we have paucity of time, we can take only up to 3 questions. Our volunteers are here with the microphone. So anybody from the audience who have questions with regards to the portal, I request you to please raise your hands. Thank you. Can we please have the microphone in the center?
Hello everyone. Myself, Dr. Dattatreya Pandya. I have Ayurveda hospitals and pharmaceutical companies. I want to know how can I collaborate or connect with that portal, and I want to register as a private healthcare sector on that portal. So from that, which portal I have to register myself and what is the process?
There is, if you want to register for providing treatment facilities, providing treatment facilities to patients coming from outside, then the moment you will click on Advantage Healthcare portal.gov.in, and you will click on the patient mobility. So that there you can register. There would be for hospitals, you can have the registration over there, and the moment you will send your OTPs and all will be generated, so and your details will be filled, then like that you can register. Yeah.
Advantage Healthcare portal, and then
Patient mobility.
patient mobility. Thank you, ma'am.
Good morning once again. I would like to stand on existing protocol. I'm Dr. Babu Mahmoud, a family physician, a consultant family physician. I will want to inquire, the portal, does it address anything that has to do with, in terms of training and retraining from medical specialists coming down here? Is there any way you can actually key into the portal? Does it address that?
So if I rightly understand the question, you're saying that are there any, is there any aspect of training that is covered under this portal?
Oh, yes.
Currently we do not, and this, I'm assuming that this is regarding the workforce mobility rather than the patient mobility.
Yes.
Right? So here currently what we are saying is health workforce who are currently trained in India and have certifications can come over and then serve in other countries. So this is not a training portal, and we have a separate ministry which is dealing with the skilling part, and I think there could be some sort of a collaboration. This is more about sending an already trained professional to go and serve in a different country.
Okay, thank you very much.
I think I would like to just add to that. You know, so when it comes to training or it comes to education, so in the Ministry of Health, there are provisions also for creating opportunities for students who would like to come and study different fields of medical education in our country. For example, for those who are interested in nursing education, in India, we have supernumerary seats which have been created in many of our nursing institutions. And if there are countries who are interested in sending their students to India for such nursing education, there are opportunities which are being provided.
Thank you very much, Ma. For instance, in my own specialty, I'm a family physician, and I'm also interested in things like travel medicine. I don't know, does the specialists actually benefit from terms of training and retraining in your institution. I don't know if it's actually covered.
The specialist training they are asking in terms of
Yes, of course. I think we have different levels of education in our country. So we have the graduate program, we have the specialist program, and we have, beyond that, we have the super specialization. So definitely, different levels of education do add to qualifications. And so you do have very highly qualified Indian doctors, and also from other allied health specialists who have been providing services in the health sector.
Okay, thank you very
Thank
much,
you.
ma'am. Thank you.
Yeah, thank you. Ma'am, I'm Saidu from Chat Embassy. I really appreciate the portal, but as we are thinking globally, I mean that you must also take into consideration the language issues, because I see that there's only 4 languages. And among most of our country, people speak French also from African nations. So why not also integrate the issue of language?
just this portal is in multiple languages, in multiple foreign languages. Due to paucity of time, we could not showcase this. However, you can log into the portal and deep dive yourself. There is a language selection criteria. So you can select multiple languages. 8 or 9 foreign languages are there.
All right. And second thing also, I'm suggesting that regarding the insurance for our guys, is it possible for them to apply from abroad instead of paying directly, to apply for insurance and then it's covering all the critical fees?
Yes, that is the whole idea, that the patient who are in other countries, they can log in, they can register as a patient, have a login ID, create one using their mobile phones and normal internet systems, and then they can only upload their own records and datas and other things. It is for the patients who are outside India, for their facilitation. We can just have one last question. I think the colleague here he's been raising his hand after that, and that's the last question. Thank you.
And thank you very much. I'm the president of Medical Council in Togo. So I want to ask you to see in this health force for mobility. In our country, you know that less than 10% of people have insurance. So for this, for the majority of the patients, we know that they cannot travel. If you want to do work on one partnership to a professional to come in our country and help the professional to get capability, skills for curing some disease, what can we do? Because in this case, I see that it was patient who can come here, but a professional who can come in our countries to help professional getting capability for treating. How do you do it? Thank you very much.
Right. So, so if I rightly understand, I'll just paraphrase. You are saying that can a professional from our country come and then train your professionals? So the idea is we are willing to send our professional to your countries. Let's say you have a body that employs them for providing the training. I think we can very well do it. So our professionals can come to your country and either provide the clinical treatment, or if you choose so, they can also train your own professionals. So it's up to the host country to decide how best to utilize the professionals that are coming over to your country. So we are open to that also.
Thank you very much. I'm Bernard Agbo. I'm coming from Cameroon, Central Africa. And I have a comment and a question. The first comment is about this. I think this is amazing that the portal, and it's really going to answer some issues that we have actually from the base hospitals. But then I think you spoke about affordability as one of the main um, baselines, um, and accessibility. But then there's also acceptability within the African context. Sometimes it's quite difficult for the people to share actually and even accept some of these online interactive sites. Also the issue of internet availability in some very remote areas may be also challenging. So like you can look into that, and I don't know, is there a non-internet based version or something like that? And my question is about the finance, the financial aspect of it. In most francophone, I think I have many friends here from francophone African countries. It's quite difficult to transfer funds, either using Visa, MasterCard. There's even no PayPal's in some of these countries. Any heads up about that? And also looking at the international restriction on, moving with cash, for example. How do we leverage that, in this case? Thank you very much.
Thank you. Uh, Regarding the accessibility for internet, yes, we are thinking on working on a mobile app for the patient specifically, so that it can be more friendly for the patient to just use an app and take a picture and upload, which will be any day much better. And offline version at this point of time we haven't thought about, but yes, our focus is to facilitate, and yes, if the demand comes as and when as the countries start using it, we can definitely work on that. Regarding insurance and all, there are insurance companies as well which will be the stakeholders. So that is something which is within the country, in a particular country, from wherever the patient resides. If they have some insurance, if a country, like that is why we are talking about having a letter of intent being signed between the two governments from India and the country. So then the country will be facilitated to have an access to this portal, have a country dashboard, and also enroll their own insurance providers and their payment gateways or whatever is there. So that facilitation can be done once the LOI is signed, and the country dashboards, country specific pages can be created in this. Thank you.
Thank you so much for helping us understand the portal in a better manner over here today. Thank you to the dignitaries for taking out time and being present over here as well. I now request and invite you all to please join us for delicious lunch, and then I'll see you in the second half of the One Earth, One Health Advantage Healthcare Conference. Thank you so much.
The lunch venue is just outside the Mahatma Mandir. If you will enter towards the ahead on the right side, there are indicators also available. So please join us in this lunch lounge over there. Thank you.
With us, Session Chair Shri Abhishek Singh, Joint Secretary ED, Ministry of External Affairs, Government of India. For moderator, we have Mr. Lalit Mistry, Co-Head, Healthcare Sector, KPMG India. Thank you so much. And with that, I would like to hand over the floor to Mr. Lalit Mistry for the proceedings of the session.
Good afternoon, everyone, and a warm welcome to this session. As we all know, in the last few decades, India and Africa have collaborated across the sectors to drive the partnerships to better the life of citizens across the borders. What we also saw during the COVID time, that how the healthcare sector could be leveraged across the pharmaceutical, healthcare service delivery, medical technology, and other financing needs of each country that can help us to better the lives of each citizens across the borders. Today, we have these sessions focusing on the medical value travel. Topic name is the collective effort in fostering the development of medical value travel sector with a focus on African region. With this focus, if you look at the topic, in the last few decades, the number of medical tourists across the borders traveling from Africa to India has almost increased by threefold out of the total tourists traveling to India for a medical tourism. If you look at in terms of the number of patients, they travel generally for the super specialty cares, cardiac, oncology, ortho, spine, infertility, and various other cares. And what we also see that in the last few decades, the partnership between the two countries has further strengthened with the private sector and the government collaborating across the borders to support in the developing the healthcare infrastructure, building the new hospitals, designing new diagnostic centers, and various other partnerships that we have seen. With this context and background, let me welcome Dr. Mohammed Hassan Mohammed, Deputy Minister of Health, Somalia, for being part of this session. We also have Mr. Abhishek Singh, Joint Secretary, Ministry of External Affairs, Government of India, for being a session chair for this session, sir. Welcome. And we also have industry leaders from across the country and from India have joined us in these sessions to provide their inputs and the valuable guidance which will help us in strengthening the medical value travel across the sectors between India and Africa. With this, let me invite today our session chair, Mr. Abhishek Singh, to provide his guidance and opening remark for the session.
Thank you, Mr. Lalit Mistry. Excellency, Mr. Mohammed Hassan Mohammed, Honorable Vice Minister from Somalia, Excellencies, Ambassadors, Charge d'Affaires, diplomats, members of the industry. It's a pleasure for us to participate in this important segment where we will discuss how we can foster and collaborate further in the medical value travel sector with Africa. With Africa, our friendship goes back many decades and even centuries, and it is on a very solid foundation. And we can see that in a session after lunch, we are very well represented from various embassies in New Delhi, various African embassies in New Delhi. I thought that maybe I'll talk a little bit about our overall policy pertaining to the pharma sector, the policy of the Government of India, and then I will talk a little bit about the medical value tourism, and then of course how we can forge and collaborate in this important sector with Africa. Friends, you are aware that with one of the largest diasporas in the world, India today is poised to play an effective role in the post-pandemic global stage in all spheres, be it economy, society, or international peace or geopolitics, representing the high aspirations of Indians in the Government of India's journey of developing robust healthcare ecosystem in the world and in the phase which we now call as the Amrit Kal. On 15th August, this year we have completed the Azadi Ka Amrit Mahotsav, and now we move towards the Amrit Kal, leading up to the 100 years of India's independence in 2047. I'm very pleased to see the diversity of representation today in the hall. They are also representing the high aspirations and offering their expertise on healthcare. And with this, I refer not only to the missions of Africa represented here, but also the members of the industry present in this hall. Friends, Excellencies, India has been on the forefront of COVID ever since the beginning. A lot was discussed also in the morning session when honorable ministers talk about what India has done through the vaccine Maitri scheme. And I can tell you from my own experience, I have recently come back from a foreign posting. I was Indian ambassador to Venezuela, and one of the first jobs that I did as the Indian ambassador there when I landed in August 2020 in Caracas was to hand over 4 tons of COVID-related medicines to the government of Venezuela, which was, of course, highly appreciated by them, and it was very timely. Government of India's initiative to provide COVID-19 vaccines to countries around the world, and in this act, India has supplied 23.5 crore doses of COVID vaccines to 98 countries and 2 UN entities. India, through its Mission Sagar, provided assistance to 15 countries in the Indian Ocean region, playing a leading role in the global cooperation, and offered India's capacity in ensuring health security and growth for all. Friends, India is known as the world leader for exporting generic medicines to varied regions ranging from Africa, which we will discuss today, to Eurasia, to mainland Europe at the most affordable rates. So many people have described Indian pharmaceutical sector as the pharmacy of the world, and there is a reason for that. I mean, we are producing the top quality medical products, medicines at the most affordable rates. Friends, in the past we have seen that whatever new vaccines and medicines were developed, India would be at the end of the queue to receive the drug. But during the COVID, India was one of the first developers of COVID vaccine, which India generously supplied to countries across the globe without relying on other countries for vaccine. This clearly shows that India is not just outshining in generic medicine, but is also excelling in specialized drugs, which will be magnified further in the Amrit Kal, which I just talked about. Another important aspect of our journey in this sector is digitalization, which is also related to the COVID-19 vaccine drive. All of you are aware that India launched the indigenous developed COVID platform as a digital tool to combat COVID-19. COVID platform monitored name-based vaccination administration of more than 1.92 billion vaccination doses in India. With interest received from more than 50 countries appreciating the efficacy of COVID app, India offered the COVID platform as a digital good to the world to combat COVID-19. Talking a little bit about our association with Africa, India's telemedicine platform, eSanjeevani, has benefited more than 390 million beneficiaries in India through video consultation during the COVID-19 pandemic, making it the biggest such platform in the world. Similarly, we are trying to extend this expertise to the 54 countries across Africa via e-Arogya Bharati. Promising results have been observed through telemedicine pilot projects conducted by India in Africa. This is a testimony of India's commitment towards partnerships and collaboration for effective healthcare delivery in Africa. Excellencies, let me a little bit talk about the topic of discussion today, which is the medical tourism, medical value travel, or medical value tourism. All of you know that it is a sustainable collaboration. It's it has got many manifestation like joint healthcare, health policy harmonization. How we can do that, we have all discussed earlier also through regulatory facilitation of medical practices, drugs, services, and investment facilities in NVT. When we talk about India's position and leadership in the NVT sector, one must recognize at the global level there is a shift in the MVT market. And that shift is from developed to developing countries. I mean, if you look at a few decades ago, for very serious ailments, the place to go was mostly in the West. But now, with many of the countries having rising old age population and healthcare cost, India has become a preferred choice in this MVT scheme. And of course, our reputation as the pharmacy of the world, and also with some of the best tourist destination, I think this combination is becoming a very good combination to attract people. And we have already, Mr. Mistry was mentioning that many of our brothers and sisters from Africa, they have come to India for medical treatment. And of course, once they are through with the medical treatment, they need to, also look at some of the tourist spots. And if they are coming to Delhi, Agra is not far away, Jaipur is not far away. So it's a good thing to round off a good medical treatment at affordable cost and also affordable tourism, all put in place in India together. And the theme of today's, morning session was also One Earth, One Health. So that is, based on equitable access to affordable health care. And we have, through our vaccine Matri, and also the way we had distributed and, extended a helping hand to our friends all across the world, we have shown to the world that though we have a, probably the largest population in the world, we not only think about our own population, but also we think about our friends and, our partners across the world. And we have shown it through our Vaccine Matri scheme. And when we talk about One Earth, One Health, we exactly mean that. And that is also in the spirit of what we call as Vasudev Kutumbakam, the world is one family. And when we talk about collaborations, we talk about global collaborations, we talk about collaboration with the African continent, we talk about collaborations with the various African countries. And it is not about, one-upmanship. Let's make it very clear. It's about, gaining from each other's strength, each other's expertise. In the morning, Excellency, you would recall that WHO DG was mentioning about the time that, when he was growing up, he had many teachers from India and Ethiopia. And, he remembered that his first lessons about Ayurveda came at that time. And now, of course, he has been very closely involved with several projects in India. And he has, of course, led WHO from the front during the pandemic. And my Ministry of External Affairs and other ministries in the Government of India which are related to the health sector, especially Ministry of Health and Family Welfare, we have to work as one unit, and we are working as one unit, and we want to promote, medical value travel through all your cooperation. We feel that this is something which is not going to diminish in the months and years to come. And with Africa, since we have got excellent bilateral relations with all your countries, with the 54 countries of Africa, and of course the African Union also, we are very sure that India will continue to be a preferred destination for medical value to travel and tourism. And our various hospitals and industry people who are represented today will also bear me out that when they have somebody from Africa, there's always an extra dose of friendship from these hospitals also. And they are, put in right in front of the queue because, we realize that they have come all the way from Africa and they are looking for, affordable treatment, a treatment that is being given by a friendly country, a country that they trust. I think we have to build on this trust. We have to further solidify the trust but we also need to, add new dimensions to our policy. We are all discussing, this is a very dynamic topic, medical value tourism, but we need to add more dimensions to this topic, and that is why today's session is very important. That is why it is very important to hear His Excellency, the Vice Minister from Somalia, and anyone else, I think, Mr. Mistry, who would like to, in the question answer round, or if they want to make some general observation, they are always free to do so. So I think after my small speech, I think it is the turn of Honorable Vice Minister. So Mr. Mistry, you may
Thank you.
invite him. Thank you very much.
Thank you, sir, for your special address. Let me invite Honorable Deputy Minister of Health, Somalia, Dr. Mohammed Hassan Mohammed, for his special address for this session.
Thank you very much. I think for a bit more warmed up, I will be going to the stage to give a small note. Thank you very much, my brother, Dr. Shiri Absheksan and Mr. Latif, dear delegates, ambassadors, international from all Africa. I see my face there, and delegates who are actually made this event possible. The Minister of Health of India, FICI, FICI, and those who made this event an event and made possible for the world to see such kind of event growing and making the world closer to patient and doctors and hospitality and hospital closer and closer. I also want to thank all the people, stakeholders, and WHO team who made this event an international event to make sure we all utilize the best way we could and made sure that the universal health coverage has the best. Ladies and gentlemen, today is a day where we have experienced the government of India, Minister of Health, has opened and inaugurated the portal for all the world to be utilized and make the patients and the world to use the doctors who are very capable in India. I'm sure most of Africans who are here or maybe back home must have encountered someone who was sick, who wanted to go to seek treatment in India. And he must be proud and happy to be treated back and come back to home and say, I got treatment from that city, that hospital. Dear colleagues and hospitals who are actually here, and consultant teams who made these efforts possible for the African people and managed them to treat here with your God-gifted hands, experience, and all the measures that you have taken with the expertise shows and felt in our homes. I want also to make sure that Africa right now is growing. We are actually have 54 countries. Population is now increasingly. Development is increasing, and hospital care is also developing. With the support of Indian brothers and country, giving us some expertise and technicals and camping to most of the countries in Africa. We have in the region, in East Africa, currently today we have had WHO Director General, Dr. Tedros, saying that he has seen in Ethiopia most of the people going to seek treatment in India. Somalia is also every day making almost more than 100 patients traveling all the way from Africa to seek treatment in here. We want also to say that as we are here, we're also working with One Health, One World, and one initiative that can create these things more flexible and more easier to everybody who is either in the government, personal, or in institutions or health facilities, which can communicate in distance or maybe can be treated whether they are in the country, and whether they are not, if not possible, they could be actually diagnosed and sent to India. In number of areas, there are opportunities of collaboration between India and Africa. Africa currently is having good doctors also, but we are trying to, some areas where we are lacking, especially those complicated, complex, and highly sophisticated diseases which maybe need specialized treatment, can be utilized in here. Innovations that can make the technology that we have, the technologies we have in here that today we have integrated, made think the healthcare system in Somalia will be more beneficial. Currently, Somalia is facing also with the same initiative that we want all the hospitals together to make one portal that can be seen all the doctors and patients can book in the system. Somalia is now increasingly growing with that innovations, but the best thing that we have is if there is anything that we need that is external from what we have there, we have somewhere we can call very good hospitality and home that has been, most of Somalis used to come and seek treatment in India, where we are currently in. Both in public and private sectors in Somalia are expanding quickly, with private sector receiving a lot of investment. The healthcare industry and medical items are another level of cooperation. Partners in the healthcare sectors are generally advantageous in both nations and will significantly advance in their economies. The other areas that we actually benefit from India, where most of the people in Africa currently is depending, is drugs, where we got pharmaceutical companies, most of them we have imported from India. And that shows the collaboration of Somalia and India being growing into another level when it comes to economics, health in drugs, pharmaceutical, and in treatment of patients and others. I'm very glad actually, and I want to conclude, we will be having the discussions more and interactive, but I also want to thank with the team who are actually with me in the panel, those who have made today to be possible and take the advantage and make sure these notes are being taken into a positive and included and back home to Africa so that we can have the best productive for our people, for the world, and for our mutual benefit, India and Africa. Thank you everybody, and thank to the Gujarati people who we are with the places. Gujarat is amazing, yeah?
Thank you, Dr. Mohammed, for your special address. Very rightly, the points that you and Mr. Abhishek have highlighted. In terms of the partnership between the India and Africa, I think we have already, just started on that front. There are huge opportunities that we have across, further strengthening these partnerships in terms of supporting, in terms of the healthcare infrastructure, building on the pharmaceuticals, medical technology, innovations, and on the digital health. We have also seen in the last few years, there has been increased investment from Indian hospital providers and industry in the Africa. We have seen that not only the patients from Africa traveling to India, but healthcare providers from India have started setting up hospitals in collaborations and joint ventures in the African countries, which is an important thing. We don't look at only at the African countries in terms of drawing the patients from them, but we also want to be part of building a robust health system in the African countries, sustainable healthcare sector. And also, important thing is that how the continuum of care can happen, not only in terms of providing treatment, but early diagnosis, health screening, supporting on the preventive care is an important element. And with India's leverage on integrated health system and Ayush, we can really play an important role on health and wellness aspect. In past few years, if you look at India and Africa have worked on many fronts. Some of them that I can highlight is Pan-Africa E-Network, which is a joint undertaking by Government of India and the AU Commission, which mainly focuses on the technology aspect, linkages on the telemedicine, teleconsultation, video conferencing, and various other aspects in terms of healthcare and education and other areas. There also has been Focus Africa program. In 2002, India established the Focus Africa program to facilitate trading with several African countries, including Egypt, Nigeria, Kenya, South Africa, in affordable pharmaceuticals, so that we could easily have an accessible pharmaceutical supply chain supporting and building the industry. Having said that, today we have industry experts from India and Africa, official delegates as a part of this audience today. We would like to hear from them that how we can further strengthen this collaboration in terms of medical value travel sector between India and Africa. So I will open this forum with this question that please feel free to share your ideas, guidance here, that how we can collaborate and work further on this. What has been done so far, and what do you think more we can be done? Rajiv, yes, if you want, please. Sorry.
Thank you, Lalit. Thank you to all the dignitaries on the dais, and thanks to FICCI and the Government of India for hosting this. I'm Dr. Rajiv Singhal. I'm the founding member, managing director of Marengo Asia Hospitals, the fastest growing chain in last 2 years since the time we acquired our first hospital in Ahmedabad. We are already 1,700 beds. We have 2 hospitals in Delhi, 2 in Gujarat, 1 in Ahmedabad, 1 in Bhuj, and I am privileged to have the chairman of our Bhuj hospital, Gopal Bhai. He actually has a business in Senegal. He is based out there from 2009, and he is the one who is chairing our Bhuj hospital. So it's good to see this association, and I especially requested him to be part of this. And it's the tale of saying how we can actually give back to the country, so he's done that. Just continuing where the panelists said, the most important change which has happened in medical tourism is by adding the word where we in this medical travel. It's a medical value travel. Otherwise, it used to be only medical tourism. Now we are calling it as medical value travel. That's the most important. It means the conversations today are not transactional. They are not only one-sided. We are not only looking at getting patients from Africa and treating and sending them back. Today, the platform is considering that can we actually work in more collaborative manner? Can we add value to each other country so that maximum number of patients can be treated? We at Marengo Asia have been a strong proponent of one concept called clinical corridor. The way we have business corridors, we have green corridors, we continue to say that push the concept of clinical corridor. In that clinical corridor concept, the idea is very simple. Few patients who cannot be treated in Africa in the facilities which are there because of the talent, infrastructure, pre-post-operative care, they can travel to India. People who can be treated, doctors, nurses can travel and can treat them there. It will make healthcare affordable, accessible for everyone. That is the most important motto for all of us. That's the concept of clinical corridor we should continue to drive. The other aspect which we say that what we need to do in our association with Africa, teach, train, and treat. The 3 T's which are very important. It means we should continue to establish partnership with our partners so that we continue to train the doctors, nurses, and do the capacity expansion and enhancement in the countries where we are partners. So our objective should be look beyond the transactional relationship, establish. One point which Gopal Bhai told me, he said, Rajiv, I am wondering why there is strong association with the East African nations, with India, but the only few nations from Western Africa, they have association and linkage to us. This is a point we should actually sometime think, and what as a government, we should take initiatives to start that promotion where one part of Africa out of 54 countries which are there in the African Union, one aspect is completely missing. So I think it's a great platform, and post this, my only request and appeal to every member who is here is that today is the beginning of a journey. Please feel free to reach out, and please reach out for the conversations and establish the relationships which are long-lasting than only one day of event which we are here. Thank you very much.
Great. Thank you, Rajiv, for your input.
Lalitji, I'll just like to add something, taking from what Dr. Saab mentioned. I think this idea of clinical corridor is, of course, very relevant and very relevant to the discussion that we are having today, and also the 3 T's that you mentioned about, bringing, in a sense, bringing medical treatment to the doorstep of our brothers and sisters in Africa. I also, missed out mentioning one very important thing that we do, which is capacity building. And, our friends from Africa know about it. The ITEC scholarships and the ITEC program that the government of India has been running for a very long time, wherein we, provide training or, at the premier institutes in India in various fields. And of course, medical, Ayurveda, yoga are, one of these fields. And this has been very popular with our friends from Africa, from friends from South America, very popular. And this will continue to help our, brothers and sisters in Africa to upskill their, existing skills in this area. I would also like to mention that, in addition to the telemedicine and the, the patients who are coming here, including those who are coming as part of the MVT, we also need to strengthen, our system, ecosystem, wherein our doctors and our nurses go to Africa, and the effort that your, organization has taken is really commendable. So that, not many people in Africa probably, can afford even coming to, of course, India is affordable, but even that cost may be a bit too much for many people. So, getting our doctors and our hospitals there would also be a great step forward. And I know that many hospitals are already doing so. Just wanted to add.
Thank you. Thank you. Yeah, please.
Thank you very much. Please allow me to ride on the established protocols. My name is Tendai Chatikobo, and I'm from Zimbabwe. I'm the founder of a medical travel unit called the Tasimba Siyangoba Foundation, TASI Foundation. It's actually named after my son, who was saved because of medical travel. He was born with cardiomyopathy and stenosis. And after establishing that he could get, treatment to help him with the areas where he's struggling here in India, and being someone who works with communities, I decided to form this foundation. So I just want to address the issue on why some African countries are not as engaging. I think there is a need to have a regional coordination for policy adaptation, because some countries don't actually have policy that then allows us to do this freely. However, I'll speak with regard to my country. We actually are having collaborative treatment now, where somebody comes here and then the doctors in Zimbabwe are also able to say, can we communicate with the doctors in India so that we can manage this patient properly? So I'm just going to encourage the rest of the African partners, to say we need to come up with probably a steering committee for medical travel in Africa that can then serve as a guide for the other countries that want to start taking part. And in that case, we begin to advocate together for policy that allows for all of us to achieve the sustainable development goal, good health for everybody. So this is my contribution towards that area. And we as a foundation have also started setting up a satellite clinic where teleconsultation will become the norm, and diagnostics as well becomes better, because sometimes you come to India and you find that maybe you need to have taken propranolol for heart surgery 3 weeks before, and then you're having to pay accommodation 3 weeks prior. But if you take teleconsultation into consideration, you find that you save yourself all that time, and collaboration is key in the treatment of any patient, and follow-ups also become very uniform and constructive when the patient is treated. Example, if my son gets a flu and goes somewhere where they've got no access to the doctors treating him, they can get very scared to touch him because they don't know what's going on. So I think we just all need to be very coordinated and to work together to influence policy so that it can be for the people. Thank you.
Great. Thank you for sharing your story. And
one more point I wanted to mention, since, two people had mentioned about this just now, about why East and Southern Africa has, garnered more of our attention rather than West Africa. I think the answer is a bit complex for that matter. Of course, as far as Government of India is concerned, for us, Africa, I mean, we look at African continent as one, and we have friends in West Africa, in East Africa, but traditionally, a lot of Indian diaspora has been also, the number of Indian diaspora has been more in, I think, in East and Southern Africa, and they have been a very strong link with our country. And but the trend is changing. If you see that the Government of India is now opening up embassies in many countries of Africa. I remember in Cameroon, in Sao Tome and Principe, in Guinea, Conakry. So, many countries now have Indian embassies where, in earlier times it was not there. So, for us, our collaboration is with the African continent. And as Mr. Mistry mentioned, when we talk about PAN e-network, it was for whole of Africa. And we are not looking at only East and Southern Africa. And sometimes, people also take in consideration the language factor. So many of the countries where, they speak English, probably they feel more comfortable coming to India. And there are many countries in Africa that they speak French or maybe Portuguese. So they probably think that there is a language barrier. And when it comes to medical treatment, they want to be very sure that they are conveying in the right way. So, these could be the reasons, but as far as government is concerned, we look at all the areas of Africa in the same way, and we have a very reasonable, embassy presence in West Africa now, and our collaboration with West Africa, with North Africa, all parts of Africa is increasing by the day.
I just wanted to add one more point here. I want to thank actually the lady from Zambia who actually mentioned a very important strategic thing. Having a portal between Africa and India will be an amazing step forward to make sure the targets can actually receive the medical treatments and in teleway, in a telegrammic and in a very consultant and informative way. People, most of them, some of them, they don't have the access maybe even to internet to know what is going on. So in Africa, it is very diverse, 54 countries. Some people maybe even don't know that people go India to get treatment. So information by mouth and the local people to be utilized will be very productive. In policy-wise, I think also India, health minister and the doctors over here going for a camping there will be also cheaper for the local people. That's also one more aspect of those people who cannot afford maybe to come here, to make a collaboration with the Ministry of Health in that country or even to a private sector hospital, which maybe most of the diseases people, they come to India is surgical, maybe some complicated cases, heart diseases, transplantation, but some of them maybe it's not necessary for the people to be coming here. It can be collected collectively, maybe 100 patients, 200 patients, and can be gone to there for actually a group of doctors joined together to go there. They have the OR there, anesthesia and everything will be provided medically. When they go there, collected the patient, they can do one time 15 days or maybe 20 days, 30 days camping information. I think everybody of us will understand that. And that will make the patient coming here, 100 patients, 200 patients, even sometimes 1,000 patients changing hip or knee replacement. Some of them currently is happening in Somalia. We take Indian professionals and highly skilled doctors to go there, do some camping. We collect the patient, and I think most of Africans will be very fairly enough if they could do the same and get the most use of this. Last point I also wanted to mention is having the telemedicine, just the point that she said, patients who cannot be able to come here, even guiding the doctors, training them to bring some professionals from that country in Africa, 54 countries, giving them short courses like you said, ITEC. Actually, I didn't know you have just said a scholarship which has been trained Indian government trains to professionals from Africa. That's a very informative point where we need most of the actually doctors to be noticed in Africa so that they can utilize and come to India, get high skilled doctors to be working with them, and when they get the knowledge to go back there and get, so that all the world grows well. We cannot cover African people by actually the doctors in India. We must also train them back home and back here so that we can reach a global health here and better with all the initiatives we have and the infrastructure that we're building in the world, which is right now. When we use internet, we can reach people in Africa very easily. Let's also get online education from the system of India. Thank you very much, and I think if you allow me, with all respect, and the whole team, I also have another commitment that I had with another team. If you allow me to go, I will also thank you, everybody here. Ambassador Dr. Ahmed also will thank you very much. You had something? Yeah, please. Please give Ambassador to the mic one time so that he make a comment. He's going with me. Thank you very much, and I'm actually glad the team who is very actually competitive, and thank you very much.
Thank you for the minister and also the other moderators and all. It's really valuable information and valuable speech that you've given us. I am Somali Federal Republic Ambassador to Delhi. Since I've been in the office, I've received a lot of complaints of Somali patients searching for the treatment. And I think when I see the portal, maybe it can be solved some problems for the problems they face in our people. I'm not complaining the whole hospitals. There's genuine hospitals, which is really I can appreciate the work they are doing. But there are some hospitals in collision with some organized rackets are indulging an unethical medical practice. We have seen and we have met so many times for that. It's the cheating, exploiting vulnerable Somali citizens, running overpricing, over-invoicing, unnecessary drug, wrong, unnecessary interventionist, all those kind of I've met so many times. And also there is so many other problems which is causing more expensive because some hospitals, or I can say mostly, they charge international fee, which is completely, it's not included by portal or something like that, or the price normal. That's also there for that problem. Also the problem also, they gave 30% of commission those middlemen, like facilitators, like translators. So all those kind of extra price and all those kind, it's happened to the patient. So mostly, I met some patient that they need more money. Then they don't have it. Sometimes we give them power of attorney to buy or to sell their, land of peace in Somalia to finish their medication, which is really, it's a painful. So I think, I don't know, I can change for the question. It is possible to solve this portal, to solve this kind of problem, or we need other ways that we can solve the problems.
Excellency, thank you very much for your input. In fact, portal can, of course, resolve some of the problems, help us in some ways, but if there are such elements and some people have experienced this kind of treatment, I would suggest that I'm sure you would be in touch with your territorial Director General, Mr. Puneet Roy Kundal, in the Ministry of Foreign Affairs, External Affairs. So if you can, have a separate meeting and discuss with him. When I go back to Delhi, I will also discuss with him, and he's the right person to, take it forward along with other authorities in Ministry of Health and Family Welfare. But of course, this is very unfortunate, and we will, once we have all the details from you, Excellency, we'll look into that, I assure you. Okay, thank you.
Great. Thank you very much, and thank you everyone for this participation. I think this discussion should continue, and we've just started, but I think it was a first step towards building a better and larger collaboration between India and Africa on this front. Great, thank you everyone.
Thank you so much to all the dignitaries and speakers present on the stage over here. Thank you so much to the audience as well for making it interactive. A lot of topics were touched upon that were necessary to discuss as well, and we wish to keep continuing these discussions. Let's move ahead and march ahead to our next topic, which is to focus on partnerships and collaborations over here. And continuing, I would now like to invite our chair for the next session. We have with us over here Mr. G. Kamlavardhana Rao, the Secretary to the Government of India, the CEO for FSSAI. The topic is promoting global partnerships advancing towards a healthy future through medical value travel. We would also like to invite our session co-chair, Mr. Arvind Varsachwi, Managing Director, Shri Shri Tattva FICCI, Co-Chair, Ayush Committee. And the moderator for the session is Mr. Satyam Shivam Sundaram, Partner, Strategy and Transactions, EY. We'll just take a few minutes to start the next session. A request for everyone to please settle down. We have few more delegates joining us for this session.
Table will focus on the CIS region, titled Promoting Global Partnerships, Advancing Towards a Healthy Future Through Medical Value Travel. I would like to now invite our session chair, Mr. G. Kamlavardhana Rao, Secretary to the Government of India and CEO for FSSAI. Session co-chair, Mr. Arvind Varchasvi, Managing Director for Sri Sri Tattva, and also the FICCI co-chair for Ayush Committee. The session will be moderated by Mr. Satyam Shivam Sundaram, Partner for Strategy and Transactions at EY. I would request Mr. Satyam to please initiate the session. Thank you.
Thank you and good afternoon, everyone. Dignitaries on the dais, Mr. G. Kamla Rao, Secretary to the Government of India and CEO FSSAI, Mr. Arvind Varchasvi, Managing Director Sri Sri Tattva and FICCI Co-Chair Ayush, dignitaries from all the countries who have arrived here as a part of this MVT conference. Thank you for being here. Allow me to welcome you once again to this conference. And today, in this session, while we will have an introductory remark by the session chair, we will look forward to hearing from each one of you your experiences, your suggestions around the topic, which is promoting global partnerships and advancing towards a healthy future through medical value travel. And therefore, it is your suggestion which is what will help us in making this MVT much better, much more richer, and the experience being much better on both sides. So thank you once again for participating. Allow me to set the context and set the expectations from this meeting. As we know, MVT today, by some estimates, would be around 115 billions, and it's expected to grow to 286 billion by 2030. Now, it is very important, and with time, it has become far more important. As the previous session and in the morning you heard that the value word which has been added from medical tourism to medical value travel is about the value that we provide and we add to each of the participants across the session. Now, in this session, what we are looking at in terms of feedback from each one of you and inputs is around identifying the roles and responsibilities of different MVT stakeholders across the value chain, both in the private sector and in the government sector or the public sector, encouraging and sharing any experiences around public-private partnerships to improve the value chain across the system, and also supporting any cross-border tie-ups and suggesting any experiences that you have had. With that, I would invite the session chair today to share his initial thoughts. Over to Mr. G. Kamla Rao.
Thank you so much, Arvindji and Mr. Satyam Shivam Sundaram. Good afternoon, everybody. So we just finished a very good round of discussion on Gulf related issues, and this is a session on CAS, as Satyam has mentioned, and more or less whatever the issues which are cropping up, almost all the similar to all the countries, but more so distinct for CAS countries because of the connectivity issues. The aviation sector plays a major role in getting people. You know very well that the students from India now, as to pursue their medicine, to pursue their medical education, they are traveling to Australia, they are traveling to New Zealand, they are going to different parts of the world, but mostly they are going to the CAS countries. Last 10 years, this trend has become very very obvious that many people, many students would like to go to the CAS countries. But the patients there from the CAS countries, they are visiting India for whatever the advantages that we have, which we have already mentioned to you here, the cost of treatment and the kind of infrastructural facilities that we have in almost all the major cities across across the country, and the kind of skill development and the kind of the quality of nurses that we have, the post-operative care that we have. So these issues which are generally debated whenever you talk about the medical value travel. Besides that, connectivity is very important. In fact, we have invited the officials from the Civil Aviation Ministry, Government of India, but unfortunately, at the last minute, they had to cancel their trip. Otherwise, you would have got definitely a better input on the connectivity issue. I must tell you that some countries have signed some kind of understanding, MOUs with the aviation sector there, the private airlines, asking them to reduce the tariff for the medical patients. In India, you must be knowing we have different kinds of visas. You have business visa, tourist visa. We have medical visa also. The medical visa is the e-visa, medical visa, along with one attendant. And Ayush visa is recently introduced along with the attendant. These are the important policy interventions in promoting medical value travel, because we are getting a lot of inquiries from various countries, from African countries, from Gulf countries, and from Canada, from UK. The availability of the quality doctors, the availability of the quality nurses, the number is increasing every year in India. People who come here, they not only stay there only for the operation, but their relatives, all of them, they come to visit India as a tourist destination in some cases. People who come to Delhi, they plan to visit Kashmir, they plan to visit Uttarakhand and different, they plan to visit Jaipur and other parts of the country. Some places where the hotels are very expensive, they like to prefer to stay in homestays. So homestay is also becoming very, very important aspect of the entire the medical value travel ecosystem. Naturally, the 5-star facilities everywhere in the world is very expensive, but relatively India is very less. But many patients who are coming, but from looking for budget hotels, when they don't get rooms in the budget hotel, they try to stay in homestays. And this homestay industry is also becoming. We are trying to give more publicity for this homestay near all the hospitals in cities like Mumbai, Chennai, Bengaluru, Kochi, Delhi, and other parts. That is one aspect. Second aspect which I want to concentrate on, inform you, is that role of facilitators. So who are the facilitators who are bringing the CAS countries to India? Let's say in some parts of the African countries, Nigeria and Gulf countries, their established facilitators are already there. They are notified, and they are well known to the hospital chain, bigger chains. Multinational hospital chains are there. They are having their own facilitators. But unfortunately, in CAS countries, we don't have the facilitators. That segment is unattended. I think we need to strengthen the role of the facilitators there. Once you identify them, they can be Indians or they can be non-Indians, but who know about the Indian medical infrastructure facilities, the medical pharma sector, the Indian pharma sector, and the connectivity, the local connectivity, local languages. Interpreters is another important aspect. Some people come with their own interpreters. Fortunately, now India is an English spoken country, so there should not be problem for the African countries. But CAS countries mostly, they don't speak English, so for them translators become very important. So some of the bigger hospital chains, they have their own interpreters, they have their own translators. But other than that, when they visit the smaller hospitals, they require some kind of assistance, some kind of guidance. So, and another point which the CAS countries are lacking is the insurance policies. Established countries in the Gulf and other places, you have insurance policies, insurance companies are coming forward. Whereas CAS countries, insurance companies are not, that systems are not yet evolved. The regulatory aspect of the insurance is not yet evolved. That aspect also we need to focus. We are in touch with the Indian ambassadors there in CAS countries. They will be helping all of you, all the local hospitals for creating some kind of awareness on the insurance companies in India. And we are also in touch with our regulatory authority here on insurance and also the private insurance companies here. We are having a dialogue, Ministry of Health and the Ministry of Tourism. We are all together, put together, we are having a dialogue with the ministries. And I'm sure we will try to evolve a good regulatory mechanism to resolve the issues related to insurance. So these are the aspects, which I thought we will discuss more based on your questions. I request all of you to participate in this discussion and try to focus on the areas where you want Government of India, Ministry of Health to respond, Ministry of Tourism to respond, Ministry of Commerce to respond, Ministry of External Affairs to respond. We'll note down all the points once you raise during the course of our debate. Thank you. Namaste.
Thank you, Mr. Rao, for your introductory remarks. You brought out the affordability, quality, access, and equity issues as a part of the medical value travel, and you also talked about the accreditation of facilitators. Now I invite our participants from various countries to make their remarks. Kindly identify yourself, and the mic will reach to you, and then you could you make your interventions. Yes, please, there at the back.
Yeah, good afternoon. Myself, Joe, from CEO of Vaidyaratnam Hospitals, Ayurveda Hospital. And adding to these points, whatever doctor said, we are having a program of exchange of programs in terms of education as well as training. We allow the international doctors to travel to our infrastructure and get trained on the Ayurveda in terms of illness, not in the wellness. So let me be very specific. In terms of illness, yes, we are focusing on the exchange of programs, and the international doctors can come to our center and they can get trained. Similarly, if the African countries, since morning, we are almost signing up with around 5 countries where they wanted our doctors to be there and give the knowledge sharing as well as the treatment procedures. So we welcome all the African as well as the CS countries to Vaidyaratnam group of hospitals, and we'll be very happy to share our knowledge to you and impart our treatment procedures to you also. So this is also adding to the more to the medical value, and I think most of the other hospitals in allopathy also they're doing it up, but part of Ayurveda we want to contribute this. Thank you so much.
Thank you so much for your intervention. I think Ayush is an integral part of the Indian system, and the kind of moving from illness to wellness is something that India has been striving to and has been doing that for years. So as our colleague said, we welcome you all to experience the wellness. And with that, let me invite the next participant. Could we have the mic here, please? Yeah, please. Any experiences, good or any other experiences that you would like to highlight which will help us? For example, as the session chair talked about, the whole accreditation process for the facilitators, which is what India has been taking for last couple of years and which has been helping. I think some kind of intervention like that that you bring out will be really helpful. So please feel free to add whatever you have.
Good afternoon everyone. I am Dr. Rakesh Shah. I represent Shalby Multispecialty Hospitals. We are the world leader in joint replacement surgeries, and we are the chain spread across India, having 15 hospitals of multi-specialty care. Here I would like to bring a couple of points wherein the decision makers or policy makers can help. When we talk about facilitators, sir, we have been talking about facilitators. So we are getting a lot of students from these countries studying with us. So if at all we can have a regional center run by a government, wherein the CIS countries or Gulf countries, the nationals or the students from those countries can be registered, and in case hospitals need any kind of help, they can work for them. maybe they can have a earn and learn concept also, wherein some kind of remuneration can be given by the hospitals. So the quality of care and communication channel improves. Second thing, these students or the facilitators from these countries having regional centers will give access to all the hospitals wherein they can reach out, because we are widely spread across, and as we represent, our headquarters is at Ahmedabad. We do face challenge about aviation, which our group CEO has already highlighted in a previous session. But these regional centers will really give an access to these patients coming at cost and getting a good quality of services. That can really help. This is just submission from our end. And of course, the students is the one thing wherein we have a mutual transmission. From India, people are going there, and people are from those countries are coming back. So these translators or facilitators issue will really help to resolve. This is a submission.
Thank you. I think at the back, please.
Good afternoon, everybody. We are from Uzbekistan, and here's a representative from the Uzbekistan Health Ministry. So yes, we have such kind of problems like for facilitators, and one of the big issue now what is going on in Uzbekistan is that too much facilitators, they are trying to send the patient, like if the patient in example, the one patient went to the hospital, and they will be such kind of the person who will tell that bring to us the patient, and after this even the patient became a facilitator. So in such kind of the way, the lot of facilitators are, and you cannot even the control. So from the ministry of Uzbekistan, we are also thinking about the accreditation of the facilitators. Like those who will have a license or accredited the facilitators, they have to be work with the hospital. So we are from our side also waiting the same thing from your side. Like hospitals also have to control. Otherwise, you know what kind of things are happening. Like I'm telling you what's happened with my friend of my friend. What's happened? He was going to one hospital, the long period, like it was a KTB follow-up. And after the lady became pregnant, and after this, what's happened that he was thinking about do such kind of a delivery, but due to one hospital told one price, and somebody, I don't know who is this, somebody told, oh, we can do this very easily for you, that in the cheap price. And that person didn't tell the all information. So what's happened? It's a premature delivery, and they need special care. Now the bill became about $50,000, where the patient was no aware about that. He's just calling me and telling me what we can do. I told it. I said I don't know what we can do, but such kind of things are happening. So for this, like it will be very good that you know what will happen. Like if somebody did such kind of the bad thing, so we have to catch them also. Like tell that you have to be responsible for that patient. You know what will happen? The reputation of the and the finally reputation of the Indian hospital will be spoiled. The doctor did their job, and all the hospital did their job, but due to one facilitator did such kind of things, all the Indian you know, the reputation of the hospitals will go down. They will say, oh, this such kind of things. This is the first thing. And you know, I'm keep working about the 10 years with India, and I know such kind of another like a Turkey or something. So now the Turkey also trying to compete the India. I know the level of the India and level of the Turkey also, but you know what's happening? Sometimes they are telling that maybe affordable prices for Uzbekistan or something. No, the main thing of the Turkey, like advantage of the Turkey was that we are the visa free. There's no visa. You know what's happened after the COVID? I'm telling you, this was a big issue. After the COVID, about approximately 2 years, there was no e-visa. 5 countries of the Central Asia, Kazakhstan, Uzbekistan, and Turkmenistan, and the 5 countries was just closed for e-visa. I was just writing them because you know what's happening. You go for embassy and they didn't care about the patient. I know by myself, the patient died before he got the visa. Okay, if you can just send the kind of the request to the government that when the patient coming with like a serious illness or something, even there is a no e-visa, okay, the embassy should be helpful. You know, I tell you that the words of that embassy guy, he told that I don't care about. He really told that. I don't care about that will die or not. I have to accept only 20% per day. And this is not my business. What will happen with that patient? I'm telling the real situation what's going. So, and we have to call the ministry telling that please help. The patient is dying. So that's why now e-visa is okay. But you know, there was a 2 years gap. So maybe the officials has to pay attention on such kind of things.
We have noted down this point, very important point, gentlemen. Thanks a lot. So we'll examine this, you know, and we'll get back to you. Kindly leave your address and we'll speak to you. Thank you.
Thank you.
And thank you so much. And I think I'll just add to the session chair that, you know, our Prime Minister keeps talking about zero defect. And it's not only in manufacturing that we are striving towards that, but also in services. And therefore, that's something that we are striving. And thank you also for you know, suggesting that the e-visa is now active, as you rightly said. So half of your problem that you described hopefully has been resolved. But as session chair said, we'll be very happy to take it forward and see where it could be.
Thank you very much.
Yes, in the front left.
Hi, good afternoon. I'm Shaz Mahmood and I'm part of the Apollo Hospitals Group and Medijourn. Thank you, Session Chair, for hosting this session. I think it's about time we all discuss global partnerships, which is what is this session. And you know, what I wanted to highlight is 2 or 3 interesting things that we've noticed post-COVID. I think the first one is about the fact that a lot of people will continue to do medical travel in spite of internal capacity building. For the simple reason that not every country is going to spend or is required to spend that amount for excellence in healthcare. For example, if I have to talk about proton therapy, a proton therapy center costs about $200 million. Does that make sense for it to be there in every country? And I think that's where global partnerships will come in the way. I think that's where countries need to align and recognize that certain specialities will continue to remain with some countries. Primary care, secondary care, even some extent of tertiary care must be developed for the whole world. It's the primary need. But is super speciality required? We have to understand that there are only those many doctors in the world, while the capacity for the world is growing. So I think global partnerships is the way forward, at least for the next few decades. Coming back to the example of the Proton Center, Apollo has one in Chennai. It is the only one in South Asia. So does it make sense for us to build capacity as nations together in that center, or try and set up $200 million centers across the world, which you are ending up just spending that kind of money which you can utilize in treating more patients? So I think global partnerships come a long way, clubbed with medical travel. The other things I think which is a responsibility for all developed nations when it comes to countries which have premium healthcare is to try and do something back at home. Again, something which we've done, this is a CIS related session. So what we did in Tashkent recently is we opened up a clinic. Apollo Hospitals opened up a clinic with 5 or 6 specialties there. And it has doctors visiting from here. It has doctor training happening there. They're adding on a lot of tele-tools in terms of teleradiology, telepathology. And I think that's helping bridge the connect and to bridge the skill gap. So I would say global partnerships is something that every nation needs to work towards, whether it's a country which has sufficient healthcare or a country that doesn't have sufficient healthcare. But together, I think, as the mission that's set out of this conclave, One Earth, One Health, I think it meets global partnerships as one of the most essential aspects of this, the entire sector. Thank you.
Thank you, Mr. Shah, for bringing out another dimension of partnership, which is bringing economies of scale and scope at one place and coordinating together. Let me also add at this point and bring out what was discussed earlier in this hall around Heal in India and Heal by India, and the two portals that you heard our government officials talk about. A lot of information asymmetry that you see in terms of pricing, in terms of hospital, in terms of facilitators, over a period of time would go off once we have these technological interventions, and India is trying to create that transparency and technological intervention as a part of it. Another quick point before I invite another participant here is to also leverage technology while you are looking at medical value travel in terms of telemedicine, both for pre and post intervention, because those telemedicine facilities, and we did hear over the years, we have heard many stories where it has facilitated, reduced the cost, and actually reduced the information arbitrage, the kind of issues that we keep hearing in stray cases. So with that, let me invite our next participant here, please. Mike, yes.
Hi everybody, this is Zaki Zadi. I just want to have a question that, for example, the Nordic countries in India, they have embassies. They are doing like excellent in circular economy, water. They have a separate department and a bureau diplomat handling those things. For example, water counselor, environment counselor. If India is like wishes to excel in the healthcare sector, why don't we have in Indian embassies in abroad have a specific health section that deals with all health sorts of issues? Thank you.
Okay, thank you for your suggestion. We'll definitely take it forward. Next, please. Yes, yeah, straight back, last table.
Good evening. This Lokesh from a representative from Jahangir Hospital, Pune. So many patients comes to us, the international patients who come. The key need for them is to understand the current medical condition of theirs, which is given by their local doctors. Specifically about CIS or even as for African countries. Can India as a country do a CSR, thus we invest in some kind of a basic medical facility for local populace there in the hospitals, so that the medical reports are up to standard, investigations are done there, and then the patients can come. Because poor healthcare investigation facilities in those countries are not up to the mark that Indian doctors can look at and identify. So it could be one of a CSR initiative from the government of India that will also help in direct patients from those countries into India for a better healthcare treatment which could be done. Yeah.
So maybe you're talking about the CSR component which is coming from the industry. Government doesn't do the CSR thing, but the industry as a part of the CSR, whether they take the overseas investments and all, we need to examine this. But the idea is good that the kind of the strengthening of this, the skills and the strengthening of the awareness generation and the quality of the reports that you're talking about is, as the gentleman has mentioned here, about that, your global partnerships as a part of the MOUs that you sign, the bilateral relations and multilateral agreements that you have, bilateral MOUs that you have. As a part of that, maybe the aspect that you have mentioned can also be included in that. Thank you.
Thank you, Session Chair. Next participant. So while we have our next participant formulating their question, may I invite our session co-chair, who also happens to work a lot in the Ayush sector. And Ayush, as you know, talks about wellness rather than just managing illness. So from wellness to illness, let me invite Mr. Irwin to share his thoughts.
Thank you so much, Mr. Satyam. Honorable Mr. Kamla Raoji, it was such a pleasure to listen to the wonderful insights that what you shared and opening up the entire session. I feel a couple of takeaways that what we've had in this particular session, at least till now, is that collaboration is the key. Not every country can stand alone by itself and also deliver great medical value to its citizens. So I think the entire CIS countries coming across together and working together to deliver quality healthcare systems to all its citizens in the particular region would go a very, very far way. A couple of points I wanted to mention across to you, that a whole lot of these challenges that come across in the medical fraternity is when the illness becomes very progressed in one's life. A lot of these illnesses can be attended to if their lifestyle is addressed at an early time. And that's where I feel India has really shown to the world that its system of life, its medical system, that what's been there for more than 5,000 years right now, that's the Ayurveda system, really shows that how one can attend to one's lifestyle. So a whole lot of these diseases, before they could become very serious, could be attended. And that's where medical value travel would make a huge difference, whereby when they come here to India, they have a healing experience. It's no more about symptomatic cure, but attending to the root cause. So sometimes your illness could also be psychosomatic. So you need to address your mental health, mental well-being, a whole lot of these stresses. We've seen so many youngsters across the world commit suicide because of stress. They just do not know how to handle their mental stresses. And through mental stress, we've seen that even your HbA1c levels also start to shoot up. The moment your stress levels, the cortisol levels in your body also increase. So lifestyle changes makes a huge difference, and that's where medical value travel through Ayurveda, through the Ayush systems, could play a great deal in attending to one's health, especially in the CIS countries. Why do I say this? Now, the Honorable Prime Minister last year also announced the e-visa on the Ayush front. We've seen that today the Honorable Minister has also launched this portal that makes it so much more easier for a person to access the healthcare system here in the country. The information is at your fingertips. So I would definitely urge all of you to use this. Having said that, even from Shri Shri Tattva's side, what do we do is that we also help doctors come and skill themselves here in India in the Ayurveda, in the Ayurveda skills, and become Ayurveda doctors and go back to their own countries. So what happens is that then later we also have this aspect of telemedicine, that how we connect all these things together. So in case if there's an illness that needs to be taken care of, one of my colleagues also here mentioned that in case if there are some specialty treatments, then it's always good that one particular country champions that. And that's something that what will go a long way. Another part is on the insurance side and also on the tech side. We've seen India especially has gone a long way when it comes to tech-enabled methodology of payment. Whether you call it, whether you look at the UPI system, you look at the RuPay system. We've seen a whole lot of countries are also accepting India as a trading currency right now. And this would also help the CIS countries a lot. Insurance will be all the more easier to get when the UPI system is also implemented in these countries. So therefore, there's a lot in store for the CIS countries in the coming years. Travel and connectivity, of course, Mr. Rao also here mentioned that the connectivity in terms of air travel was also discussed in the previous session. And also, this is something that what the government is also addressing. And that will also really help when it comes to medical value travel. Visas have helped. and also the Ayurveda visas, the Ayush visas, whereby people can attend to one's lifestyle, would go a long way in the collective health of the planet. So I think that this medical value travel is going to be the fulcrum, or rather the foundation of bringing good health to people all across the world. And the seed being also planted here in India, it's been the vaccine giver to the world during COVID, and I'm sure that there are a lot more solutions that what this wonderful land has to offer to the world, and it's all for us to explore. So I think with these few words, Mr. Satyam, if anybody else has any other questions, then I think Mr. Rao and me will be happy to address. Apart from that, those are my inputs. Thank you.
Thank you so much. Any questions, comments? Yeah. So I'll just add one comment to what you said, and with that probably we could move towards the closure. Is that we just heard a lot about Ayush, particularly Ayurveda. It also has Unani, it also has Siddha, and it has Yoga, something that all of you have already been conversant with, particularly Yoga. And we have a separate ministry of Ayush, and it's as today there's so much of research happening in this area as well, that it is also as much becoming an evidence-based medicine as the modern medicine. So it's a great blend of the two that you could experience here in India. And with those words, I think we could close the session with your permission.
Mr. Satyam, just only one point I wanted to add, that today, as we all are sitting here, we are actually witnessing the birth and the first summit of the WHO in terms of the traditional systems of medicine. This particular summit shows that there's already so much research behind entire traditional systems, and I think now with the advent of AI and also modern day technology, we'll again establish the relevance of these systems in a much more stronger way than what the world would find it to be palatable. I think that this is a great day for traditional medicine, that the WHO has set up for the very first time a center for traditional medicine out of its own headquarters, and I think India is championing that very well, and it's a great day for all of us here today. Thank you.
I think we have a couple of people at the back.
Yeah, I just wanted to bring in a small distinction in this. You made a very important point about illness to wellness. And this word wellness has been used so extensively that it has lost its meaning unless it is contextualized. Insurance companies use wellness, the government of India uses wellness, right? The massage centers use wellness. What is wellness? So I think it is important to distinguish between what we call therapeutic wellness, leisure wellness. I think that will be good for the country, for patients to differentiate what is the service they're coming for. How do I differentiate between a therapeutic wellness and a leisure wellness? Leisure wellness would be like going to a Thai spa, a Swedish spa, coming to a resort in a place. And if you look at the fact that 1.5 million tourists visit Kerala, for example, right, pre-COVID, a bulk of them were visiting for, in quote unquote, a wellness reason. But in fact, they had a health reason which they were trying to find a solution for. 30 to 40% of tourism revenues in Kerala comes from this Ayurveda-based thing. So what I'm positing here is to understand that when we look at medical value travel, we should clearly distinguish, number one, between therapeutic wellness and leisure wellness. The moment we do therapeutic wellness, the OECD countries, from where we don't otherwise get traffic, they come for Ayurveda. The European, Western Europe, Eastern Europe, the Americas, Japan, Korea, they come to India for Ayurveda. So this is one clear distinction which we should make. The other part is that we often talk about non-communicable diseases and rehabilitation, right? What can any country do to help people with a serious rheumatoid arthritis or with any other such condition, which is a chronic systemic condition? The fact is that most of the standard of care for these conditions is only pharmaceuticals, giving medicines. Whereas we have whole body, diet, lifestyle, counseling, medicine, therapy, integrative, comprehensive, holistic approaches, which are time tested. And the world is willing to accept it. So I think it is important in this entire discussion to bring the fact that there is also a tremendous opportunity for not only India, it could be India and other countries to take Ayurveda and yoga and present it in its true colors. Finally, rehabilitation, right? So these are huge areas which is pre-tertiary quaternary, post-tertiary quaternary. And I just wanted to share this, that we have a tremendous opportunity. Thank you.
Thank you so much. And just to, summarize one particular point that what, comes out of this is that I think the world has really matured in a way whereby it's no more which pathy is better, whether it is allopathy or Ayush or whatever pathy that what's there. It's what's relevant to the patient at that particular point in time. In case if the Ayush systems are relevant to that particular patient at that time, then that works better. But in case if he requires more interventional treatment, then definitely allopathy is something that what scores better. So this is something that what we definitely need to take back, that the system needs to be patient-centric rather than pathy-centric. And no system is mainstream or alternate. It's what the consumer decides what's relevant to them at that particular point in time. And that's something that what the world is focusing on and moving towards. Thank you.
Yeah, please. I'm Dr. Kavar from Key Healthcare. I have a question, it's about challenge, not question in fact. Many countries, they're facing a challenges, the medicines part, the medicine plays a vital role to treat any patient. Many countries, they doesn't have orphan or unlicensed medicines. I'm talking about the life-saving medicines. How or what measure we should do as a collective to procure such medicine in such countries? Thank you.
See, sourcing the medicine from established companies is well known to the world, and whatever export which is happening from our country to different parts of the world, we know, all of you know very well that almost all 60% of the vaccines to WHO, they go from this country. And during COVID also we have given to more than 100 countries. So when you talk about medicines particularly, that when you are exporting to different parts of the country, and the and the quality aspect, if you're talking about, we have not received many major complaints about anywhere, because of it is thoroughly checked, thoroughly certified. So only after certification the exports are taking place. We are talking about the medicines coming to this country, to this India. The most of the API, almost all 60 to 70% of API comes from China, right? So, and we also import other aspects of the medicines. Then there is a system, there is a regulatory system within the Ministry of Health and Family Welfare. We have CDSCO organization, which regulates the quality aspect of the medicines. If you have a particular case, then you can always take it. We'll take it up with the ministry.
But here I would like to appreciate the Indian government. The Indian government took the initiative to, via DCGI, the Drug Controller General of India, they issue the license to the patient. It's about name, patient, supply. They issue the license and we can procure. But what about the other countries like the CIS and African region? Thank you.
So yeah, I think we are already crossing the time. So let me, thank all the participants here for your comment, and for all of you being here to patiently hear many of us speak about various topics. This is a very important subject to look at, medical value travel, and as we talked about, particularly looking at the affordability, efficiency, effectiveness and equity aspects of it, and with technological intervention and with various other interventions, Government of India is trying to make it as holistic as possible, and we look forward to engaging partnership as we move forward. Thank you so much once again, and enjoy the evening. Thank you.
low waiting times, and unique ecosystem of traditional medicine, India has emerged as an important stakeholder in the global healthcare landscape. State-of-the-art infrastructure in India is evidenced by nearly 40 plus Joint Commission International and more than 1600 National Accreditation Board for Hospitals, which are those accredited hospitals, offering the latest techniques and technologies for greater accuracy and holistic well-being. In addition, the country has the largest pool of healthcare professionals with about 1.3 million highly trained allopathic doctors, more than 800,000 Ayush practitioners, and 3.4 million nurses and auxiliary nurses and midwives that we call as ANMs. India's healthcare ecosystem is extremely affordable and cost-effective. Medical treatment in India is almost 65 to 90% depending on the treatment that you're looking for in comparison to the Western world, and surgeries such as the heart valve replacement, heart bypass, and spinal fusion, which is nearly 90% less costly than other countries in the West. Even procedures involving dental treatments such as dental implants are much more cost-effective in India. A unique advantage of India is its therapeutic and wellness system, which I'm sure even in the session prior to this, there was ample discussion about the Ayush systems and the WHO recognizing the importance and the leadership that India plays in this domain, and having its own first dedicated center of traditional medicine being set up in the country. A recent example highlighted in the media is about a patient from Kenya who witnessed significant improvement in her eyesight through treatment at an Ayurvedic hospital in India. Through these and many more advantages, India has become an important MVT destination for patients from all over the world. As we are aware, the patient journey has its own typical life cycle, commencing with the pre-arrival planning and booking with due diligence, then the arrival and the treatment part, followed by the post-treatment levels phase that we know. Each of these phases is crucial and lead to the patient's overall satisfaction levels. In line with this, the global patient journey in India has also been quite smooth through a structured and comprehensive system of hospitals and clinics, medical facilitators, insurance companies, and supportive government regulations. While measuring patient satisfaction would be useful, the growth of MVT itself through the word of the mouth and sharing of success stories is an important assessment factor. Several measures to improve the patient journey and overall satisfaction have been adopted globally, and of course in India as well, which I hope we shall be hearing of more during this session. We also look forward to hearing from the success stories of patients who have undergone medical treatment in India under the care of skilled doctors, and we would be hearing them share their experience and satisfaction levels during their journeys in India, and also some of the areas that we could further improve or some bottlenecks that could be removed for a seamless journey, meeting their desired satisfaction levels. With this, I would like to pass on the floor to my colleague, Ms. Himami Zimomi, who serves as the Additional Secretary in the Ministry of Health and Family Welfare, to take forward this agenda. Thank you very much.
My senior colleague in the ministry, Mr. Jaideep Kumar Mishra. Esteemed delegates, a very good afternoon to all of you. I'm truly honored to welcome all of you to the session on success stories of patients from all over the world revolving around their medical value travel journeys in India. True impact in healthcare emerges when the lives of ordinary people are transformed for the better. We are determined to continue working towards ensuring that quality and affordable healthcare reaches all citizens of the world. India has been moving towards creating a unique healthcare system that embraces the need of every individual and is dynamic in its approach. With more than 1,600 NABH accredited hospitals, more than 40 JCI accredited hospitals, availability of qualified allopathic doctors, Ayush doctors, nurses, auxiliary nurse midwives, and allied health professionals, India's healthcare ecosystem is well poised to cater to the global community. This session is special in its approach as it has been designed to enable people as beneficiaries to come forward and share their personal experiences. Such forums are crucial in fostering open and inclusive discussions on various facets of healthcare policy and industry frameworks by enabling citizens of different countries to shape major decisions on healthcare at the highest level. These discussions help us in building stronger, healthier communities and reiterates the message that every voice matters and that through active participation, individuals can collectively shape the future of their societies. Such discussions and initiatives can help us move forward to our collective goal of universal healthcare outlined in the Sustainable Development Goals 3. Friends, as we work to strengthen our tertiary and quaternary care ecosystems and in building a continuum of care for patients all over the world, we hope that stories of the impactful patient journeys of those present here this afternoon will inspire us to improve our collective global health architecture. India is committed to facilitating many more successful patient journeys at a global level, and we are grateful that G20 has emerged as a collaborative platform to further our goals as a world community. We will now listen to the perspectives of our friends here as they detail their healthcare experiences in India. Thank you.
Thank you, ma'am, and thank you, sir, for the kind remarks. I will now request Apollo Hospitals Group to talk about the success story. I would also like to invite the Dr. Chirag Shah and Dr. Pushkar Srivastav to talk about the patient that they cured, oncology patient. Please, doctor. Sure. We also have the patient in the audience, would love to have her on the stage as well. We have a chair as well, so we can. So over to you, doctors.
Namaste. Good evening. We are very thankful for this opportunity to talk about this patient, Miss Jean, who is sitting in front of you here. When we got an invite, we were told that you have to share a miracle story, and it was very difficult to understand what a miracle is, because we don't do any miracles in medical field. It's a science we follow, and with that science, I suppose for an individual patient it is a miracle, for that family it is a miracle. And Jean is one such patient who came to us 6 years ago in January 16, 2018, and when she reached us, she was admitted right away from the airport, and she could not lie down flat. It is in fact a miracle how she traveled and reached us all the way, because she had all the signs of severe SVC compression, and we realized that we had to do something very quickly. The same day we did the CT scan, and then after looking at her condition and the CT scan, my colleague pediatric intensivist Dr. Pushkar was immediately involved, and he will tell us further how the difficult course we handled.
Thank you, Dr. Chirag. So when Jean arrived at Apollo Ahmedabad, honestly, when I first saw her, I couldn't believe that this is the girl who has taken a flight and has reached India. I do not know how she reached. This was no less than a miracle. She had a big mass inside her chest, and I'll try to explain this in as layman terms as I can. So there was a big mass which was occupying a significant part of her chest, and it was kind of compressing both the air passages as well as the large blood vessels of the body which tend to return blood to the heart. And if your supply to the heart reduces, obviously the cardiac output reduces, and she was in such respiratory distress because of this large sized mass and the effect it had on the heart, on the lungs, that she was not even able to lie down. All she could, for the last couple of days, she was sleeping sitting erect. Even reclining was very difficult for her. I really do not know how she came all the way from her country to India, and she was able to manage it through a normal flight. That itself was very amazing to me. So we had to do a CT scan, and when you do CT scan in such cases, it is a very challenging task. Like normally as intensivist, you would go in and see a child with breathing difficulty. We will put them through what is known as rapid sequence intubation, and we will put down a tube and then try to ensure that the breathing is taken control of. But in such cases, when you do this thing, it is a big mistake. And typically when you intubate, the cardiac output is lost, and even the breathing is like sometimes totally missed. So we really managed her in a way where what is known as, like, we did through something called awake intubation. We decided to make sure that we do not take away her entire respiratory effort, because that would have been very deleterious. Even in the best of the centers, intubating these patients and sedating these patients is very difficult. The only reason I was able to do it is because we have a state-of-the-art pediatric ICU. We are equipped with the latest modern equipments, and I'm supported by a team of specialists. So we have pediatric neurologists, we have pediatric cardiologists, we have pediatric cardiac surgeon. I, at the back of the mind, knew that I have got support of all these multiple specialities which are trained from the best of the institutes in this country, and some of them have been trained abroad. So because I had that backup with me, we were able to do slightly what is known as like conscious sedation, and with this we were able to intubate her. We had multiple backups ready for her, that in case if during this procedure if something happens, what is to be done next. And that is all because we are a very state-of-the-art hospital at Apollo Ahmedabad. So once that was done, we did a CT scan, we had a report, and then our interventional radiologist came in, did a biopsy. Once we had that biopsy report, Dr. Chirag jumped in, and believe me, if his chemotherapy would not have worked, then taking Jean out of the ventilator was a very, very, very tough job. But thankfully we have Dr. Chirag, who kind of miraculously, he made sure that the mass melted away, and whatever compression it had on that venous return and the artificial and the trachea which she had, that we were able to then, after 6 to 7 days, successfully able to extubate her. When Jean came here, she was definitely not as big as what she is today. She has now grown bigger than both me as well as Chirag, and it's really wonderful to see her in this shape. Thank you. Dr. Chirag.
Good evening. So my name is Jane Wanjiru Kenywa, and I am from Kenya. So I would like to start by appreciating India as a country as far as healthcare is concerned. It's really doing well, and it only gets better from here. So at 14, I was diagnosed with cancer, and I was about to join high school, and it was a very confusing period. So my parents decided to take me to India because the reputation it has in our country in terms of their treatment is really well. and that is as far as cancer treatment is concerned. So we came to India. At that point, it was really bad. Like, I'd walk for a very short distance and will get out of breath because of the mass that was on my chest. But at that point, I never knew what that was. I was just like, I can't walk that far. So we went to Apollo. We were picked at the airport by Apollo Hospital. And then we did a couple of tests to really know what was going on. And in the midst of all that, I suffered a cardiac arrest, and I ended up in the ICU and under life support. It was very surprising because as far as I wasn't well, I did get into the hospital working, and then all of a sudden I'm in the ICU and under life support. So it was a very confusing period, and we never knew if, I'll make it out alive or not. So by the help of Dr. Chirag and his team, and of course the Apollo team, I did get out of the ICU, and I was admitted in the ward. So in the ward, when I woke up, it was like being a child again. I couldn't talk, I couldn't eat, I couldn't walk, and I had to do physiotherapy to be able to walk. I had to take speech therapy to be able to talk, and I had to start with a soft diet to be able to eat again. And at that point, I did really appreciate the little things that we do take for granted. So we stayed for 8 months in India. We were being treated by Dr. Chirag, Dr. Pushkar, and a team of doctors. I was able to get well, and I'd say not cancer-free, but in a way where I was okay to go back home. And I did join high school after that. And in the midst of all that, I suffered like the side effects of the chemo and the steroids, whereby my hip was infected and it collapsed. So I had to come back to India, and I came to Apollo still, and with the help of Dr. Tejas Thakur, we were able to do we were able to put in a hip implant, which I still have today, and it really, really helped because I was really unable to lift my left leg. So Apollo has really seen us through a lot, and very, very many lows that we never knew we'd make it out of. And thanks to them and their team and everyone involved, I'm here today, and of course God. And yes, thank you so much.
Good evening. My name is Magdalene Mwaniki. I'm mom to Jean. I'm the one who accompanied her when she came. That was in January 2018. I was here with her dad. And as I start here, most of the times I really do not have words to thank Dr. Chirag and team, because when we came here, Jean was such a hopeless case, but I had to hang on to hope that my daughter will get better. I remember when coming here, I kept praying to God, please heal my daughter, and I decided to see only one side of the story. It really didn't matter about other people who had gone through the cancer treatment and were not making it. I decided I'm going to believe in God. I'm going to believe that I am being handled by the best team, and my daughter is going to get well. My daughter had just done her primary school education, what we call in Kenya KCPE. She had performed so well and had been admitted to one of the best national schools. But just a few days to her admission, she was diagnosed with cancer. And what we did immediately, she was diagnosed, we decided to come here to India. Thank God, we landed to Apollo Hospital, Ahmedabad, where the team of doctors worked tirelessly to ensure that my daughter's health was restored. I remember when we came here, the first day when they did the CT scan, she suffered from cardiac arrest, and she was in ICU for 10 good days. And when she came out of ICU, she had totally lost her voice. She couldn't speak. And for about 6 months, I remember Dr. Chirag kept doing a lot of consultation until finally, when she was able to speak, after so much, a lot of practice, a lot of therapy, she was able to regain back her speech. She speaks with a very soft voice, but I'm so happy, eventually her voice was back. As I start here, most of the times I really do not have words to thank the doctors, because when we went home, after like about 8 months, She suffered from her leg started paining. I understand it was because of chemotherapy effect. So her hip joint collapsed, and we had to come back here to India, and we came to Apollo Hospital where they did a hip replacement. She was only 15 years when we did the hip replacement, but I thank God it has been so successful. She has never had any issue with her leg ever since we did it. She has gone on to complete her high school education. She did very well, and she's now in university pursuing a degree in law. And every time I look at my daughter, I actually call her my miracle daughter. I know there's God in heaven. I know with the kind of commitment that Apollo doctors have, we can be able to gain so much. So thank you so much, Dr. Chirag and your team, for a job well done. Continue doing that. We know in Kenya we have actually, we are so indebted by what you are doing. I've seen so many other clients coming here to Dr. Chirag. I actually refer many people to Dr. Chirag whenever they are going through these cancer issues. And most of them have come back with a lot of success stories. We are forever indebted to Apollo India, and thank you so much, India, for the good job that you are doing. We appreciate you every bit of it. Thank you.
On behalf of Apollo Hospitals, thank you, Dr. Jaideep Misra sir, Hikali ma'am, for providing us the platform. And it is always pleasure to share the success stories like this. Thank you once again for providing this. And we thank you both the doctors and patient Jean for come across on this platform. Thank you very much.
Thank you indeed. It was a really heartwarming story and really good to hear that Jean is doing so much better now. So before we move on to the next doctor and patient, I would just like to request the hospital to please stick to 5 to 7 minutes of presentation, and because we have other sessions also lined up for the day. So I would like to now invite Dr. Nitin Singhal from Marengo Asia Hospital, and would request if you could also bring along the patient, if possible.
Namaste. Good evening. Big thanks to the organizers and to my mentor, Dr. Rajiv, for giving me this opportunity to be in front of you all to present this case, which was I would say, a major challenge. I would have gone through many major surgeries in this short span of 10 years, but this has to be among one of the top 5 cases that I have treated in this journey. This lady who had presented to us about 5.5 months back, Ajidya, around 65 years old, and she is from Kenya, and she was diagnosed a year back in Kenya when she had her large ascites. That is, her entire abdomen was filled with fluid, which was of tumor. And generally, when the abdomen is filled with this sort of a fluid, it is considered as an advanced stage cancer, a stage 4 cancer. And exactly that is what happened with this lady. She was diagnosed as a stage 4 cancer, and considering it is a stage 4 and a very late stage cancer, she was put on palliative chemotherapy with little hope that she would make it. And as the thing happened, because this tumor, they don't respond to chemotherapy, she kept on progressing. And by the end of 1 year, her condition became really, really bad. She became very cachexic. Next slide, please. She became very cachexic. She was not able to even eat. She was not able to stand. She was not able to do any of her co-work. And when she landed up in India, she actually visited several hospitals, starting from Mumbai to Delhi and several others, to name few. And because her condition was so bad, her abdomen had become distended like a big football because of the fluid, and that was pressing on her diaphragm. She was not able to breathe also. She was not able to stand. Her albumin, which is a critical element for any surgery to be done, and that decides on the healing power, which should be generally around 3 or more than that for such a major surgery, it was just 1.3. And her blood pressure, it was just 80/50. Urine output almost nil. And in that scenario, and she was not able to eat anything from her mouth. So in that scenario, she landed up with us. When from all the other places, she got a thumbs down, and she was actually planning her way back to Kenya with no hope that probably she will not be able to make it up. Somehow she landed up with us, and because we deal in this sort of cancers regularly, and we have a wonderful team in our hospital with a fantastic infrastructure, so we took it as a challenge and thought of giving it a shot, and we discussed this case in our multidisciplinary team. Generally, the biology of these tumors is such that if you treat them well, they have a very good prognosis. Going by that same, I would say, the strong belief that these tumors generally do good with the surgery, we took it as a challenge and tried to optimize her and took her up for a major surgery. The major surgery, which would have lasted 10 hours or more, and in such a critical condition, was, I would say, in a common sense, it would be a big, big no. But somehow, because of the team support, we went ahead with it. And I'm happy to tell you that she successfully went through the entire surgery, and she could withstand the surgery and did us a remarkable recovery. And within the span of 3 to 4 weeks, she was back home. And now, 5.5 months down the line, she's back to her normal life. She's in fact sent me a video last week where she was working in her farms. So that is what is, I would say, truly unbelievable, and I would say Almighty's wish that, that can transform the lives of the humans in such a way that you cannot even imagine. That is unimaginable. So I would share a few pictures of her journey. Please, next slide. Next slide, please. So you can see, when she first came to us, before that, it's her lying in that sofa in Kenya. She was not able to stand. Her departure from Kenya, where I don't know how she traveled that long from Kenya also in that flight. At the hospital before surgery, you can see her abdomen all blotted. She was not able to sit, stand, or do anything. Then the major surgery, you can see all that jelly-like tumor, the gelatinous tumor, which is the jelly belly or the pseudomyxoma peritoni. Next slide, please. Then she recovering post-surgery, her hard work started after our hard work was finished. And she was a very good patient to do that. And she recovered beautifully in the hospital, and we discharged her within 10 days after the surgery. And this is how she is in present day, walking. And I would say it's all possible because of the vision of the hospital and the dream care team that we have and the logistic supports that we get. I would like to have my patient to speak on this, on her experience.
Good evening. I first is to thank you and to have this opportunity sitting before you, saying first thank to God who has given me this time, who has kept me even this moment to say a word to you. On my journey of this sickness is from 2021, when I was diagnosed with cancer of stomach, and that time I was really unhappy, because I was knowing that when you get cancer, your time is short, and you can go to the road in time. But during that time, I went to Failures Hospital in Kenya, starting with Ruai family in Ruai, and I was told that time they cannot meet my need because the cancer has gone even to the 4th stage. So I was told to find another hospital, and I decided to go to Aga Khan, Aga Khan, I got the Dr. Alpha, and she told me she will send me for further investigation, and I went to see another doctor who did X-ray and biopsy, and he told me that the disease has gone so far, and I was told to go and see another doctor called Dr. Sitina in MP Shah Hospital. And that time, the doctor told me that my cancer has gone so much, it is in the fourth stage, but she will try to give me some chemos. If it fails, she will know what to do next. So she did me the first chemo and the second chemo, and it come to a bit harder because I started vomiting, until I saw that these drugs, they are not helping me. So I went to Kenyatta Referral Hospital, and I was treated also there. Given, they told me what they can do is only to continue with that chemo. And that chemo they did for 8 chemos, and I finished those 8 chemos, but the problem was coming bigger and bigger. And I was told now, what you are going to do is only you go home, you eat, and you stay at home. So when I reached there, I told God, now what am I going to do now? Because the disease is going or is coming bigger and bigger and bigger, and I said that we prepare with my husband that we will come to India to fight in the treatment. And how I came here to India, it was a miracle. Because first of all, I went to Kenya Airways. They told me I cannot come to India the way I was. I was told you cannot go to any hospital without an ambulance, without a doctor, a nurse, or what. But at the end, I moved from Kenya Airways, I went to Kenya, India. The flight of India, and they didn't ask me for anything. I just took the papers, and I saw myself in India. I went to the Apollo Hospital in Mumbai. I stayed there for 15 days. After testing me, examining me, they told me that they cannot handle my problem. So I went home. I was in a place called in the and I stayed for 4 days there in the house, this rental house, but guest house, and I went to Fortis Hospital in Delhi, and there also they told me they cannot handle my case. What we decided now is to go back to Kenya. We decided to go back to Kenya without any treatment. But for 2 or 3 days, I got a phone from my son who is in Qatar, and he told me he has found a doctor who can handle my case. And he is here in Amdhat. But he told me he has to do some examinations and some tests so that he can know whether he can take my case. And he took the video, he examined me, he tested me, and he told me to come to his hospital in Marengo CMC, Sims Hospital. And there I got my treatment, and I was very happy to see Dr. Nitin, who cared for me very much. He cared for me very much because I was not doing anything. I was not eating. I was not studying. I was just sleeping. But he had helped me so much, so much. And I thank him very much with his team, the way they took me and the way they handled me. And that is how I am today. And he told me to go to Kenya for 3 months so that I can come for the next appointment. And I have seen God doing a good thing to me, and I'm happy. May God bless you. Thank you.
So, thank you very much, and I'm very proud to be a part of Maringo Asia family. Maringo, with permission of my sir standing here, Maringo actually stands for Napoleon horse. And this Maringo is actually the horse of healthcare success. So we're riding on it, and we hope everybody joins us in this wonderful journey. Thank you.
Thank you so much. And now I would like to quickly move to Krishna Shelby Hospital, Ahmedabad. For that, I would like to call Dr. Pranay Gujar and with the patient as well. You don't have, okay. So they don't have the patient currently, but over to you.
Good evening, everyone. Namaste. I'm going to narrate a story of a 63-year-old lady who came all the way from western coast of Africa, Ghana. As we all know, Shelby is a renowned orthopedic center with a history of last 30 years. So we have been come across so many such cases in our 30 years journey. I would like to narrate this story. She was a lady who has been operated 5 times for her left hip before she came to India. She came to us in 2022. Before that, around 2020, she had a domestic fall and she had a neck of femur fracture on her left hip. For that, she was operated at Ghana with a routine hemi-arthroplasty of left hip, unfortunately which got infected. Next slide, please. Unfortunately, which got infected. So for the infection, implant removal and cement spacer 2-stage procedure was done in Ghana. That was surgery number 2, followed by surgery number 3, which was a revision total hip replacement, which was again performed in Ghana. She had hard luck. She developed dislocation of that left hip. For that, she was operated in Ghana again with a revision with larger femoral head. So when she came to us, she had undergone already 4 major surgeries on her left hip. Next slide, please. So she had complaints of inability to walk and limp, shortening of leg around 3 centimeters, and pain on her left hip region. Next slide. So this is her history. Hemi replacement of her left hip was done elsewhere. First surgery, removal of implant and antibiotic cement for infection. Second surgery, revision total hip. Third surgery, revision with large head. Fourth surgery, next slide. So this is how she came to us. So we had several challenges performing this case. First, there was no abductor, so it is naturally an unstable joint. She had been treated for infection, so recurrence of infection was a major issue. 3 centimeters of shortening, we had to correct that shortening, and we had to provide her a stable hip which can last for another, say, 15-20 years for her rest of her life. Next slide, please. So, next slide. So we perform a revision hip surgery, re-revision hip surgery on her left hip, 5th time in Shelby Hospital, Krishna Shelby Hospital, Ahmedabad. Unfortunately, that also got dislocated when she was at home because of domestic fall. So she had to come again to us, and we did her final revision, that is 6th surgery at Krishna Shelby Hospital. We used the constraint liner, after which the patient has finally returned to her all activities of daily living. Next slide. So this was after 5th revision surgery. Next. So this was quite a challenging case. The challenges were first to remove the acetabulum, which requires explant system, which is something we have in our hospital. As I said, Shelby Hospital, Ahmedabad is one of the largest joint replacement center in India, currently performing around 14 to 15,000 joints in a year. So as primary cases are increasing across the globe, we are getting so many revision cases in this form in our hospital. So we had to retain the femoral component. We had to use constraint liner to prevent future dislocation. And after the surgery, she had almost same limb length as opposite side. Next slide. So this was her X-ray last when she sent us this X-ray around 4 months back. Now you can see the hip is well in its socket. Both limbs are almost equal, and she has been walking and she is enjoying her life back home at Ghana. Unfortunately, she has moved to uptown, so we are not able to connect her today, but we are in continuous contact with each other, and she's happy with the surgery what we have done at our hospital. Next. This is a video of her daughter when they were there in the hospital.
Hello? Where is this speakers concern in the circle?
Hello, I'm Elham, and this is my mother, Madam Salifu Nasata. We came from Ghana with the problem of the hip. She has been operated several times with the hip, but no avail. But somebody introduced us to Krishna Shelby, and we came, and God being so good, she's now walking. Everything is successful. They done the surgery. We thank Dr. Vikram Shah and team for the successful work done. A very big thank you goes to Mr. Tija Shah and Mr. Dilip, and to the nursing staff, the ward assistants.
Next.
We say a very big thank you to them all. Roma, we say a very big thank you to Roma, Ashish, Gita, and Rajun for their help, and to the nursing staff. We cannot mention all. To Deepika, the in charge, Smita, Sonal, and the rest. We say a very big thank you to all for your help.
This
and
is
your
just before she
guidance
left
through
after
our
6th
stay
surgery.
in Shelby Multi-Speciality Hospital. We are so grateful for your help. So we are very happy. We will send your good work across to the whole world. Thank you.
Next, please. So these are her current walking videos back home at Ghana. So this surgery was performed by Dr. Vikram Shah, Dr. Jawahar Pachore, Dr. Amit Kshatriya, and I myself was also part of this surgery. So it was a marathon surgery which lasted for around 2.5 hours, and we got best of the results possible for that lady. I would like to thank FICI for providing us the opportunity. I would like to thank Shelby Hospital, Dr. Vikram Shah and team to provide me the stage to present this miracle case in front of you all. So we are treating patients across Africa for last 15 years. We were the first one to have their own clinic in Kenya. We currently have our own clinic in Kenya. We also have OPDs in Dar es Salaam and Uganda. So people from East Africa as well as part of Western Africa, they can travel to our hospital for best of the best orthopedic treatment. As we can say, we are the market leaders in orthopedics and joint replacement in India. Thank you.
Thank you.
Thank you so much. And for the other case study, we have the doctor and patient both online. It's HCG group, Dr. Sridhar.
Can you hear me?
Yes, we can.
Hello, good evening, everyone. And so I'm Dr. Sridhar PS, oncologist, radiation oncologist from HCG Bangalore. And so along with me, our patient from Nairobi, Serafin Mopai is there, and our mother, Christine, is there. So both are joined along with me. So please welcome both of them. Welcome, Christine and Serafin. So just to tell about Serafin. So Serafin is like now, like they came to India in 2010. So she was actually diagnosed with, she had a history of fall and like she was with the seizures in 2009, end of 2009, and she was evaluated for the same. And they found to have a brain tumor, which is in the space occupying lesion in the pineal gland area. And then we found, when she was evaluated there, done a biopsy, and turned out to be the grade 2, grade 3 astrocytoma from the pineal gland. So when they were searching for what to do for the further management, which the neurosurgeons had advised the radiation therapy for the same, and they were looking for the IR centers. The facilities at that particular time was not great in back home. So they opted for coming to the Bangalore because they searched online and some of their friends also advised. So once they came, so we had a slide and block reviews, and with the multidisciplinary team, so we decided to go ahead with the radiation therapy and chemotherapy together, and which is taken for around 4.5 weeks, followed by cyberknife boost, that is giving extra dose to the residual tumor. So that's what we did. It is back home in 2010. Afterwards, she was given a temozolomide tablets also for 6 months, and she was under follow-up every once in 3 months for first year, and once in 6 months for next 2 years, and once in a year for next up to 5 years. After 5 years, now she is on follow-up once in 2 years in terms of PET scan and MRI, and now it is 13 years now. So she is doing once in 3 years, and the disease is absolutely under control and almost a complete response. And when we started, the pineal gland tumor is one of the rare tumors which is surround the pituitary fossa is also nearby. So it was a very, very challenging for us to make sure the tumor should be under control. She should not have a long-term treatment-related side effects. That's why we opted the cyberknife treatment, where the accuracy of the treatment is very good and local control is good and treatment-related side effects are less. So now she's all the milestones in terms of growth is already all fine, and disease is under control. That's what she is now, and leading the good quality of life. And she's an opera singer, and she's continues her singing skills and making everybody proud of that. Serafin and Tristan, if I would like to ask you to add on your experience.
Yeah, thank you. Thank you. Good evening, ladies and gentlemen. Thank you for giving me this opportunity to share my story. My name is Serafina Moipei. I am from Kenya. My journey began back in the year 2009. Although the correct diagnosis was not made back then, after visiting various hospitals, my story with HCG began in 2010. Before then, I had made many visits to countless doctors, but the real cause of my ailment was not accurately detected. I was 14 years old and struggled to do basic tasks such as getting anywhere in the house. I didn't realize it, but I was extremely forgetful. Following my frequent forgetfulness at doing things or taking to instructions, I almost said goodbye to ever trying to remember things at all. It got to the point my social life also changed while in school. I didn't behave like any of my pals and struggled to keep up. I only thought I was different. But why was I different? I only questioned myself quietly, never realizing at all what weight lay in this word, different. My personality changed very drastically. I struggled to fit in everywhere I went. My school life was unimaginably difficult. I spoke to my parents about this and they supported me and helped me rebuild in my self-esteem. I struggled to be orderly, which was something I never realized to be a task, to put things in place. I asked myself many questions, not finding any answer. I enjoyed to play the flute and piano, but even this became increasingly difficult. Furthermore, I struggled to sing and eventually lost the one thing I treasured most, my voice. This was very painful because being a singer was an integral part of my identity. I stand here today to say HCG Hospital Bangalore gave me back my voice. Since receiving treatment, my quality of life has improved immensely. My balance is back. I am now able to navigate stairs with ease. I can walk long distances by myself without any help. I have my coordination, which had disappeared. My memory is continuing to sharpen. Every day, I no longer have blurry vision or struggle to read music. I am able to express myself more coherently. I am now a music teacher in one of the leading international schools in Kenya, something I never thought I would ever have achieved. Thank you, HCG Hospital, for your education and invaluable contributions in the field of medicine. You are critical motors pushing forward the frontiers of science. Thank you, India, for being a country that has given great hope to the rest of the world, where humanity moves from a state of illness to wellness, especially in the fight against cancer. Thank you, HCG Hospital, for making me whole again. That's my testimony as one that came all the way from Kenya to India while unwell and came back to Kenya very well. We will forever thank HCG Hospital and the entire team of doctors. A special mention to the chairman, Dr. Ajay Kumar, together with Dr. Shiva PS, for their passion towards restoring my health back to normal. I am forever grateful. Thank you once again.
And just to add to the statement from my daughter, my name is Christine, the mother to Serafina. I have worked with her for those 13 years, as she has mentioned. And yes, it was a great journey. It was a journey full of anxiety. But yes, we did get to know about the wonderful hospital in India, that is HCG in Bangalore. And from the moment we knew about HCG, and our lives were transformed. I can say it was not in one day. It has taken quite a few years, and yes, but there is hope. And this is the hope that we would want to tell the whole world, sitting here in Nairobi, that there is hope, that it is not all gloom. And we are too grateful to HCG Bangalore For even now, as we speak in Kenya, we have a consulting office right here in Kenya to help as many Kenyans as possible to have the right diagnosis, because in most cases, it is the diagnosis that causes a patient to struggle so much with what would ideally take a short time for treatment. We are not saying that it takes a day, but with correct diagnosis and with the correct personnel, kudos to Dr. Shrida PS and the team in Bangalore. We are here seated with my daughter who is leading a normal life as a young, beautiful lady. Thank you, HCG. Thank you, India, for your contribution towards humanity.
Thank you, HCG Group, and thank you, Seraphine. Good to see you. Now I would like to request Dr. Neeraj Vasavada from Zydus Hospital along with the patient. So as requested, please request you to keep it little short. Thank you so much.
Good afternoon all. Dignitaries on the dais. I'll try to be as quick as I can, because I want to finish the session in time. So we'll do away with my presentation. When we were asked to speak about a miracle case, we were brainstorming that which patient we should come up with. And we thought that everybody would be presenting miracles here. Why not to bring somebody who has trusted Indian healthcare in general and Zydus Hospital in particular, since for so many of his medical problems, because healthcare is all about trust on the system. So I'm here to share a story of a patient, Mr. Yusuf, who flown from Kenya, and it's a story of his resilience, his will to survive, his will to get better in his life. So the story will just briefly narrate. The story will started around 10 years back. The gentleman got 2 gunshot injuries, operated twice for it. Patient also had urinary problems, got operated for it. And then patient started having neurological problems. When patient came to Zydus in 2022, patient came with symptoms of gait imbalance, was not able to walk. He was losing his memory. He was finding it difficult to speak. His speech was going. And our neurosurgical team headed by Dr. Kalpesh Shah, they diagnosed that patient is having a hydrocephalus, a condition wherein the CSF, the spinal fluid, gets accumulated in the brain and it doesn't drain out. And that causes compression on the brain, and patient was suffering out of it. Quickly, the decision was taken to operate. The challenge is where patient is known case of chronic kidney disease. Patient's kidneys are not working properly. Patient is having chronic diabetes. Patient has been multiple surgeries in abdomen. Patient was also medically very, very fragile patient. However, because of the experienced team of neurosurgical science and our hospital's infrastructure, we could manage the patient, and patient was shunted. The CSF was diverted into the abdomen so that the pressure from the brain relieves, and patients started becoming mobile again. What happened next was patient started having frequent falls. Patient was not able to walk. Patient started falling. 4 months he had sustained 2 falls, and patient again started getting bedridden, and that's when patient came to us, my team of spine surgeons, and we could diagnose that his one vertebra, the last L5 vertebra, has slipped forward and it's compressing and almost cutting off the spinal cord, making him immobile on the verge of paralysis. We decided to operate, but again we were facing the same challenges, 5 to 6 surgeries. Kidneys are not functioning properly. His diabetes is haywire. He underwent 2 angioplasty surgeries during this time. His heart was very weak to sustain a surgery. Our team, in deliberation with each other, decided that we wanted to operate this patient to make his life better and support him to be all right. But the challenges were many. And the only solution which we could found was, if we can operate with as minimum blood loss as possible, maybe we can come out of this surgery safe and make this patient happy. We decided to do most advanced minimal invasive spine surgery. So rather than opening too huge or too big, we decided to operate from a portal which is not more than 18 millimeter, that is 1.8 centimeter opening on the spine on both the sides. and we decided to put screws, fix the spine, and make patient all right. Fortunately, because of our technologies and experience, probably we are one of the highest experienced minimal invasive surgical team under one roof at Zydus Hospital. And successfully, we could manage the patient. And he is the live example. Patient has been just operated a week back, and today patient is walking corridors with, he's out almost from his bedriddenness with little support. Patient is gaining slowly back his normal life. And all because of the Indian healthcare and the excellent what Indian healthcare system and political will is bringing to us. Thank you so much. I would invite my patient to just quickly say a few words if it's okay. Thank you.
Good evening, everybody. I would like to thank God first. Okay. I would like to thank God first, and then I would like to thank every doctor, every nurse, literally everybody in Zydus Hospital. Thank you so much. We appreciate. My dad is the strongest person I've ever met, and thanks to Zydus Hospital, he's good. He's good now.
Thank you so much. And now I would quickly like to request Dr. Rajiv Vasudev. From Ayurveda Hospital.
Can I have the presentation up, please? Mr. Mishra and Ms. Hikomi, my name is Rajiv Vasudevan from Ayurveda Hospitals. From the very inspiring stories that we heard from both the patients and the hospitals that preceded me, I want to take you into a slightly different journey, right? There is this entire possibility beyond surgery, right? So take this case of a very senior US doctor, advanced Parkinson's disease, multi-type pain syndrome, 9 years chronicity, how Ayurveda can help to really treat this patient, appropriately integrated with modern medicine, right? So if you look at common symptoms, I think there is a formatting, there's a slight thing which has happened here, but basically these symptoms are very well known, that in advanced Parkinson's, how all these symptoms come. And if you look at the stage of care from the prodromal symptoms which start almost 25 years ahead of the formal diagnosis, and how the disease progresses through from non-motor symptoms to motor symptoms to treatment complications. Pharmacological management of this condition today, there is no gold standard. There's nothing really which works beyond giving dopamine medicine of 3 types. For the paucity of time, I'm going to be very, very crisp here. But suffice it to say that today there are no effective treatments for Parkinson's. So if you look at it, there are issues like this where the therapeutic window of levodopa, when you administer it, the availability of this is limited due to multiple reasons, which we believe through Ayurveda, we are at a whole person level, we are able to address. I'll share this quickly. There's another problem very specific to Parkinson's, which is a phenomenon called wearing off, wherein you find that the same medicine during the day, intra-day, wears off, and the patient does not start suffering those symptoms. And the moment he takes medicine, it gets resolved. You'll see over the stage of early, moderate, and advanced Parkinson's, that window keeps shortening of the effectiveness of medicine. So it's a very tough life for advanced Parkinson's patients. Complex pains of multiple types originate. Typically, strong, aggressive, harmful medicines are given to manage pain. Ayurveda gives a systemic approach, completely different host-based approach to manage pain. How do we see this? Through a complete comprehensive, this is classical Ayurveda's approach to whole person care and what we adopt at our hospitals, but it is an appropriate personalized diet, lifestyle, medicine, and therapy. We'll tell you what it is. Quickly to tell that it is a multimodal approach to managing Parkinson's. Again, for paucity of time, we can go into details, but I want to convey to you that Ayurveda has a very structured way to to classify and characterize every patient in terms of the specific stage of that disease with these symptoms. So the multiple pains also that they suffer, different pains. This is multimodal, multiple types of pain in a Parkinson's patient. So these clinical outcomes are expected, and this case, quickly to tell you, gentleman from the US, senior pain management specialist, and his benefits. So you can see 9 years chronicity, lot of history, Ayurveda treatment systematically done. You can see one very important thing. He used to take 6 to 7 times ibuprofen a day for his pain management, down to once a week, from 7 tablets a day to once a week. One of the top pain management specialists in the US. Why I bring this to your notice is that while we attract the best of the world to India for quaternary and tertiary care, Ayurveda attracts people from the most developed countries as well. If you look at the Unified Parkinson's Scale, the Neck Disability Index, again, there is clear improvement. These are international outcome scales. You look at pain reduction across a variety of points, you can see how there is a reduction in pain happening. This is across multiple types of pain, right? Gait analysis, again, noteworthy improvement. Look at the biomarkers, and I want you to note on this. The metabolism has improved, the inflammatory markers, we're not shown here, but there has been some improvement in that. But importantly, the last two things you can see the improvement. See this particular latest paper on homocysteine and correlation with Parkinson's. This particular data, 24.9 to 12.6, the normal range is 5 to 15. We managed to bring in 2.5 weeks a very clearly indicated biomarker within range, which is closely correlated with Parkinson's. No safety issues, completely safe, no adverse events. A lot of people, without knowing the details, ascribe safety concerns to Ayurveda. Just to tell, absolutely safe, been doing it for 18 years. And this is the important piece here, patient-reported outcomes, right? Leave everything. The weightages, patient is poor on all these parameters. Within 20 days, poor to very good, poor to almost close to excellent, and the last 2 points again, excellent. So this comes to present this particular quick video. It takes a minute. If you can, please. Just blow it up, please, and the volume. Volume? Yeah.
I've retired from clinical practice in the recent past, but I've been in clinical practice for over 30 years. I was diagnosed with Parkinson's disease in 2014, and the primary symptoms at the beginning of a tremor in the left hand. It worsened progressively, but I got into a good treatment program. So the residual symptoms which I was left with was an occasional loss of balance. I was under the care of Dr. Christine Chadwick in the University of San Francisco in the US. In 2019, I was having worsening symptoms in the form of increased spasticity, increased pain, and decreased mobility, which seemed to have suddenly decided to take a turn for the worse. That was my first time that I evaluated treatment modalities and came down to try Ayurvedic treatment. And I was looking for a center which integrates Ayurvedic principles, Western traditional principles of physical care and rehabilitation, as well as a global approach to care for the patient. The treatment has benefited me tremendously. The amount of, for instance, I was taking a fair amount of ibuprofen, about 8 to 10 tablets a day. We've been in treatment now for about 2 weeks on a daily basis, and my intake has come down to maybe about 1 or 2 pills a day at best. More often than not, I have not had any. I was having a lot of spasm in the upper back, and maybe I was not able to do this. and following treatment, were able to go and the full run. But that is because this particular center, and I think at the very outset what impressed me was the chief physician at this setup, Dr. Zankana Butch. Her transparency, her discussions with me, and more important, the team that she has accumulated with her are incredible, phenomenal, dedicated, and in agreement with the aims and objectives that she has listed for herself, for the team, and for the organization as a whole. I have visions of trying to transform this into an apex center for the treatment of musculoskeletal disorders. I am partial towards Parkinson's disease because I believe that...
Okay, so I think because of paucity of time, but just suffice it to say one of the leading global experts in anesthesiology and pain management endorsing with evidence his own personal experience. Next slide. Yeah, just to tell across multiple parameters, it is showing not only the disease, but at a whole person level, how we've been able to correct the problem. Integrative Ayurveda management is poised to become a treatment of choice for neurodegenerative disorders, Parkinson in particular. We run a chain of hospitals, including JCI accredited, NABH accredited, QA accredited Ayurveda hospitals, which are also part of leading top hospitals in the country, including these type of awards. So this just to say that Ayurveda offers a choice for chronic disease, non-communicable disease, and rehabilitation. Thank you very much, Mr. Mishra. Thank you, Fiki. Thank you, the Ministry of Ayush, for nominating me for this role. Thank you.
Thank you so much. And with that, we would like to conclude the session. And thank you, everyone, for the patience. And now we would like to start the next session as well. And requesting the session chairs and the session co-chairs to please join us on the stage, on the dais.
Thank you so much. Well, miracles indeed happen. It was absolutely amazing to see so many life stories coming up over here and sharing their journey. Thank you so much for all the courage that you have shown to all of us. Marching ahead to our next session, which is Innovation and Technology Development in Medical Devices for Improved Patient Outcomes, Revolutionizing the MVT industry. I would now request and invite our session chair, Dr. K. Hari Prasad, President, Apollo Hospitals, to please join us over here on stage. With a huge round of applause, may I please invite Dr. K. Hari Prasad. Welcome, sir. I would also request our session co-chair, Dr. Sharad Kumar Agrawal, National President, Indian Medical Association, IMA, to please join us. And joining our chair and co-chair, now I would like to invite our moderator, Mr. Sumit Chandana, partner, EY, to please join us over here. I would also now like to invite our panelist over here for this session given. We have Mr. Simpson Emmanuel, the CEO and Managing Director of Roche Pharma India. I would request Dr. Satya Sriram, the CEO, Preventive Health, Apollo Hospitals Enterprise Limited. Mr. Aditya Banerjee, Managing Director, B. Braun Medical, India Private Limited. Dr. P.K. Minocha, Director, Merrill Life Sciences Private Limited. Dr. Ajay Gandhi, Associate Clinical Director, WEFAN. Dr. Dhiren Shah, Director, Heart and Lung, Marengo Asia Hospitals. Mr. Girish Raghavan, Vice President, Digital Platforms and India Technology Center, GE Healthcare South Asia. And joining the panelists on stage, we have Dr. Dagar from Yashodha. Thank you, gentlemen. All over to you.
Am I audible? Is it audible at the back? All right. Respected dignitaries of India, of the world, welcome to the 6th panel discussion on innovation in medical technology and its impact on patient outcomes, especially in the light of medical value tourism. I'm joined by an esteemed set of panel members led by Chair Dr. Prasad and Dr. Kumar as well. Technology is everywhere. And what you heard about the heart-wrenching stories so far in the last few sessions would have made it look so easy. But thanks to the medical technology behind it, and a lot of work done by companies who are there on the panel today, that we are able to get the patient outcomes that we see in today's world. Technology from artificial intelligence, 3D printing, CAR-T technology, a whole host of technologies starting from patient screening to diagnostics, to treatment, to upskilling of healthcare professionals, to monitoring and for preventive care. I think across the value chain, the role of technology is pervasive. Not that everything has been accomplished, a lot needs to be accomplished. For the size and scale of a country like India, it is a journey. There are efforts being put from all sides. The private sector will talk here. There is a government impetus on interoperability of One Health, which means that a patient today can control the records for a longitudinal treatment for chronic diseases. And a lot of that is helping the One Health agenda, which is a culmination of drug, diagnostics, devices, working together to improve patient outcomes. Some statistics, the med device industry in India is about $11 billion. India is among the top 20 medical devices markets in the world, and the 4th largest in Asia, after Japan, China, South Korea. We spoke about the technologies. I think what I missed out is on the wearables, which in a big way are impacting monitoring. And the chip inside prosthetics today is expected to do wonders as the technology gets sophisticated. So to the esteemed panel members, there are a set of questions. We've discussed some of that. But I would like to begin by inviting the chair, Dr. Hari Prasad, to take a few minutes and set the context before we get into it.
Good evening. First of all, thank you for being here. End of the long day, and you're still here at 5:36. But I guess on behalf of the panel, we won't keep you here for very long. So I'll be very crisp and short. We are flooded by technology of various kinds. Newer innovations, plenty of them coming our way over the last couple of years. whether it's technology, a new drug, a new treatment modality, a new diagnostic modality, whatever it is only going to be successful if it provides access. When I mean access, it should either provide geographical access to people, to financial access. It should either reduce the cost of diagnosis, reduce the cost of treatment. It should be able to be financially inclusive. And third, and most importantly, it should have an impact on the outcomes. Unless these three are addressed in a positive manner, none of the innovations, none of the newer technologies are going to be sustainable, and we've seen a lot of technology going down because they have not been able to address these three key elements. And over the next couple of minutes, you will see the panel talking about how their innovations and technology have impacted either one or all these three areas of providing access. Thank you.
Thank you, Dr. Hari. Let me begin by inviting some of the panelists to speak about their thoughts. And I'll start with Ajay and Dhiren. You are incidentally sitting together as well. If you look at some of the success stories that you have introduced as a medical technology company and a hospital working together, would you like to talk about some of the ways that this innovation has helped patients who have come into your partnering hospitals? We'll be keen to know about what recent success stories you can share with the audience here. Yeah, you can take the sequence, Dhiren and Ajay, one after the other.
So, hello. So first of all, thanks for inviting and giving this platform to share our stories and our involvement in the medical technology. So we at Maringo Sims Hospital, we have one of the most leading transplant center, heart transplantation center. So we do get a lot of heart failure patients, and we all know that managing, monitoring, and treating this heart failure patient is a big daunting task for everybody. We know that in a medical field, there is the diagnosis, then there is investigations, then there is monitoring, treatment, and then again a monitoring. So there has been advancement in all of the fields except probably the monitoring aspect. But with the recent advancement in the wearable things of monitoring, remote monitorings, this thing has come up in a big way, and probably that is going to change the scenario of how we treat the patients. For example, in heart failure patients, for very small thing also, you need to keep that patient in the ICU. And we all know that remaining in the ICU itself is a big issue for the patients psychologically also. So getting that patient out of the ICU with a remote monitoring system on his body, wherein a doctor or surgeon sitting at home also can monitor that patient, so that the patient is in the room with his family enjoying his life. So it helps psychologically and even the economically, because the burden cost, financial cost is also reduced. Going further, you can send these patients home also, and we can have a monitoring of that patient. We have this heart command center at our center, wherein we monitor these patients with the vitals like the heart rate, blood pressures.
I'd like to pause you here because you're making a very important point that not only is the time in ICU reduced if you're able to do remote management much better, also the cost of treatment goes down if the stay inside ICU is reduced. Yeah. But I'd like to bring Ajay in here as well, because from a technology standpoint, what is it that is powering this management? And if you'd like to throw some more light, Ajay. And I'm wanting 2 minutes with each because we have round of questions.
So essentially what Dr. Dhiren is talking about is a remote viewing, remote monitoring. But I am representing a different aspect of new technology that he has adopted as part of the Maringo Sims hospital. So whenever we talk about any kind of procedure, any kind of intervention, we talk about blood. The first thing that you usually think when you're going for a surgery, whether it's a heart transplant, whether it's a trauma, it's a delivery where the mother is bleeding a lot. First thing that comes to your mind is, oh, there will be some blood that would be required. And essentially, this hospital, Maringo Sims, which is doing one of the only hospitals in this part of the world, which is doing 6 transplants, I would say they're doing 7 transplants, because every blood that is given to a patient is another transplant that we're doing. We're taking it from some other place, we're giving it to a patient, some other person to another patient. Now, essentially, why we come into picture is we have come together utilizing technology and skill sets and certain protocols to make sure that, one, whenever there is an instance of bleeding, or when we anticipate abnormal bleeding in a patient, we make sure that not only do we diagnose or identify it in time, 2, we do it quickly, and 3, we use the right set of drugs, right set of interventions, right set of blood products to make sure that we arrest that kind of a bleeding. Now, coming together, Burfin and Maringo Sims, they have come up with this patient blood management or gold arterial bleeding management protocols, wherein going forward, what we are trying to do is we are trying to justify every blood which is being given to a patient, because when you are managing such a bleeding, or when you anticipate and when you take care of certain steps, not only are you managing bleeding at that point of time, but you're also making sure that in the longer run, the complications that you could inflict to your patients by giving blood or any blood product, they are also reduced. So eventually we've been talking about improving patient outcomes. If you give less blood to a patient, or you give no blood to a patient, even in complex surgeries like heart transplants, eventually in the longer run, the overall outcomes will be improved.
Ajay, very exciting. And as this scales up, this technology, I'm sure this is going to go a long way in transforming healthcare. I want to draw attention this side to Dr. Satya. Talking about remote management, and who better than you to talk about it, considering preventive health is your area, and it is the future. A lot of effort is being put, but it's not about behavior modification, not easy to do. You can give as many devices, but it scares the shit out of patients. So how do you do behavior modification using technology? How does the nudge work?
Thank you, Sumit, and thank you for the opportunity to speak here. When we think about preventive health, it is actually well before even you enter, right, a hospital and have a diagnosis. And increasingly, that's becoming a problem across developing countries. We've seen the developed nations and where they're headed. It's now a problem, and we need to arrest it. The first area, I'd say, is around individualization. We test, either over-test, or we don't test for the right things. We have used technology to identify what an individual's risk is, and then to be able to test for that personalized individual and say, what are you at risk for and what should you be tested for? The second area is actually getting people to understand what's happening inside their bodies before it's too late. That is a big problem, because a lot of what's happening inside is very intangible. We've used technology, augmented reality, to be able to help people identify what, based on their risk factors, what's going on inside their heart. How does the plaque build up? And what happens if you do not take care of yourself? But the good news is you can do something, and how do you actually then go down the path of lifestyle modifications? All of this through a HoloLens and an augmented reality that then helps it make it tangible for people to then understand what's happening and hopefully make that behavior shift. At Exhibition Hall 2, we have a demo of this set up, so please feel free to come by and see that. And the third piece is walking away from the hospital unit or the clinic. Once someone leaves your care, how do you stay in touch? Remote monitoring to be able to pick up vital signs very early and prevent a future setup, or making sure they actually are compliant with the medications or the follow-up care that you've recommended. We use an app and a digital nudge to be able to ensure that people are thinking about this, not too directly and overtly, because sometimes that ends up people ends up ignoring it. Instead, we actually give them articles and information and content to be able to help build their awareness and then help them actually make the changes themselves.
Great, great. Looks like really exciting stuff. And I don't know how many of the people here have attended and seen the stall, but please, you're encouraged to go ahead after this and have a look at that. Mr. Banerjee, I would like to get your thoughts, considering you represent Bebron, one of the largest and oldest med device range of companies in India. A lot has changed in global technology, and India offers you a fairly double-edged sword, right? On one hand, there are regulations which want to reduce prices so that it's affordable to all. At the same time, you want people of India or anyone coming treated in India to also get access to best technologies, which comes at a certain cost. How do you balance that as a multinational? And what have you done to, come out of this dual situation?
Thank you so much. So I'll just recall a conversation I had a couple of weeks back with somebody in Singapore who said that in Singapore, the healthcare budget a couple of years back overtook the defense budget, and last year it has overtaken the education budget. It's now the biggest piece in the budget. Now, if you transpose that into an Indian scenario, you can imagine what we are looking at. So I think, we have always worked earlier in trying to develop technology for the healthcare professional. And there was no limit. We could do whatever we wanted as long as it delivered a better quality of healthcare. I think what is changing now, and this was also the message from the conversation I mentioned, is that don't just develop technology which just gives a better quality of outcome, make it simple, make it affordable. So that is where the focus is changing. We are now looking at more and more products where some of the other panelists spoke of moving the care away from the hospital to the homes, to make more ambulatory medical devices which people can use without being in a hospital environment. I think this is the need of the future. It is already being seen in Europe, and I'm sure it will soon come to us also. So I think it is about moving away. Earlier it was about just reducing medication error or improving visualization for surgeons. We have done all that. But now the focus is how can the patient take care of himself while being at home. So whether it's home dialysis, whether it is being able to, especially on chronic ailments, how do you have medical devices that help you monitor, that help you take care of yourself. So that is the focus, what is going to be looking forward.
Sure, thank you. And it's interesting that Dr. Minocha is sitting next to Aditya, and I'd like to ask you a question, considering you are bringing technology from India for the world. Yeah, and my question to you is very simple. How do we create 10 medals in India? What is missing in the ecosystem that is preventing 9 or 10 more such companies come up which can bring technology from India to the world?
Thank you very much. This is a very good question, and I will give an answer giving one or two examples which way we have taken over, and the same perhaps is needed. This is how in a country like India, where medical device policy also has come, a very aggressive policy, where from a 12 billion to 50 billion, we definitely need to do that. I have a small presentation. Maybe that will give an example, and maybe I will explain you in a much better way in just 5-6 minutes.
Dr. Minocha, we'll keep that for a later part because we are running short of time, and I just want to make sure the panelists are able to. You can take a minute and talk about it, but we'll have to go ahead.
I'll just tell you very important thing. See, for anything, when we talk about medical device, interaction with doctors, interaction with cardiologists, interaction with surgeon is very important to understand what is the unmet need. This is what we have done it. Just 2 examples will prove you. One of the cardiologist surgeon who used to do an open heart surgery for valve replacement, right? He was talking that, doctor, you people have developed a good technology about the stands, the tapered stand, and that bifurcation stand, the long length stands is fine. But this open heart surgery has a lot of difficulties, and many patients do not survive, and generally patients are old. It's very difficult, So this is a challenge which probably if you can take it. And the challenge is not this. Challenge is that there are certain devices available internationally, for example, but heart is such a delicate device. This is behind lungs, very small piece, few chambers for different bloods, few valves. Whenever we use that kind of valves, they require sometimes supplement implant, pacemakers, in more than 15% cases. So this is not going to be simple. But Merrill, we have one big slogan, you know. If there is a bigger challenge, that means it has a bigger opportunity too. And third thing, and if we cohesively, now your answer comes here, come together, regulatory comes together, infrastructure comes together, government comes together, this opportunity becomes the reality, and this is what we have done it. Now here, I will say that doing this, I can say that there were hardly 5 or 6 centers doing this surgery. Today, more than 150 centers carry out this surgery in India using our technology. We brought down the cost less than 50%, and across the world, more than 12,000 have been implanted, and we believe a valve implanted is like a life saved. And our pacemaker requirement has been just less than 5%. This is just one case. I have hundreds of cases, but maybe I will take one more case before I end. I am sorry that, but this is very important. When you say that you want 10 such things, 10 such companies, then people have to think in that respect. See, today, when most of the Indian companies and most of the Indian procedures, especially for say knee replacement or other implant replacements, the manual surgery, which requires 200 kgs of surgical instruments and power tools, navigation systems. Imagine the kind of complication. I agree that there are certain expert surgeons who can be doing beautifully. But you know that robotic surgeries have come in the world. Why can't India take the lead? We took this again as a challenge, brought robotic arm, converted it to our implants, and today more than 70 robots are there already doing several surgeries, and the benefit is less blood loss, no navigation, better alignment, and patient recovery much faster. So idea is that you need to not to be in isolation stage. You have to interact basically with the surgeons, you have to interact with the cardiologist, and then you have to interact with regulatory system that this is what you are going to do it in advance. And when all strengths are brought together, such things can be achieved in the country.
Sure. No, excellent point. And the fact that you are talking about working closely with your customers for innovation and taking it to the world is very well made, sir. So we are talking about more convenience, less invasive treatments on this end. I think you also spoke about the fact that you can reduce the time spent in ICU, less blood loss. I think all of these are great innovations. But you touched upon ecosystem as the requirement, and who better than Simpson to ask this question? Roche is an integrated diagnostics pharma company at the cutting edge of technology. To your mind, what are the global best practices of Roche that have already come to India, which allows treatment at lesser cost than global standards, but at par to the global standards when it comes to quality of outcomes?
Okay, maybe I'll start with the vision statement or the 10-year vision statement that Roche has. It says that a 3 to 5 times higher patient benefit at 50% cost to the society. So that's the objective that we have. Now, one of the reasons why Roche is also structured the way it is to look at the entire patient journey rather than look at it as a pharma company or a diagnostic firm. So we have 4 entities. In India, we have 4 entities. Globally, it's pharma and diagnostics are there, and also Roche Insights, which is the third arm. Because we feel that we need to look at a patient and a society holistically rather than in isolation. To your question specifically, we do invest a lot in R&D. In fact, we are the highest investors in healthcare as far as R&D is concerned. Not just in healthcare, even across the sectors, Roche is one among the top 5. Now, R&D and innovation is only as much as useful when it reaches the world and the public, and this is where I would like to bring in the overall vision statement that we have, which is about how do you impact the society per se. I can think about the speed in which we responded during the pandemic period, when the entire world was grappling with what is to be done with this new phenomena which is happening. Roche was one of the first organizations to kind of come up with diagnosis of COVID, and not just about the kid, but also about how do you do it in scale and how do you do it faster. And not just across the world, but in India as well. Because with all the constraints that we had in manufacturing and all the technology that was not available at that point of time, we were one of the first responders to this particular situation and helped millions of patients across the world. And just something which is relevant to India as well as the world. When we look at our products per se in pharma, our objective is to impact the society overall. I'll give you certain examples like our breast cancer drug, Fesgo. Traditionally, if you have to give the drug, you need to kind of like have a 3 to 4 hour infusion, and by the time that patient travels and it's done, it's close to a 10-hour time that the patient spends, and that has been converted into a short 10-minute subcut injection, completely transforming the way in which the patient experiences. And we have in fact delayed launch of some products because we wanted to crack the societal cost. Our SMA drug, usually given either as an intravenous or an intrathecal injection for infants and babies, was developed as an oral solution. Because without that, the benefit is not going to impact the patients. So I can have multiple such examples come in hemophilia and so on and so forth. And it's not just that, it's also about how do you integrate technology overall and the power of data insights. In India, we also have Roche Information Solutions, which is a big unit in Pune, close to around 350 data scientists and engineers who are working on that. This center, in the short period of time of existence, is already filed for 5 patents. We have close to 6 algorithms which have been developed. 11 solutions have already been deployed from what was created in the Pune center across the world. So there's a lot of things going on, and in fact, just last month we established a partnership with, we set up our data analytics unit with ZS Associates. We also have something called as Global Analytics Technology Center, GATE, which is there in India. So it's about looking at it very holistically rather than a piecemeal product offering that you can have, and bringing all of these things together, I think, is the magic sauce.
Wow. So you talk about patient experience, you talk about the convenience and the value of data science in the whole thing. Let me bring in Girish. You represent GE Healthcare. What is the future that we can expect that data science will take us into, considering we are just scratching the surface?
So firstly, thanks Sumit for the opportunity. Okay. Yeah. So I would say a couple of things. One is we are just after improving patient outcome. I think some of the panelists covered that, right? As we know, the third largest cause of death in the world today is misdiagnosis and mistreatment after oncology. After cardiology and oncology is the third largest contributor. So definitely a large space played by AI and data science would be to how to democratize healthcare, which means that you provide AI and data science to help clinicians make the right decisions in a much more seamless manner. That is definitely one big space. Second big area would be how to make our systems much more intelligent and smarter. So today, by default, the assumption is the CT scanners or devices are dumb. The operators are very smart, and you have to operate the system with intelligence, right? As you go forward, and it's happening as we speak, as the systems are getting more and more smarter. The systems are able to tell the technicians, look, the patient has moved quite a bit. Maybe you should do a rescan. Smart enough to go and pull information from RIS or HIS and recommend technologist in a much more seamless way than in the past, right? So this makes the level of skill required to operate systems come down drastically. But the biggest we're going to see in the future would be the evolution of 5G. With 5G coming into place, with all the things we are seeing with virtual care and remote patient monitoring, so on and so forth, we find that 5G in the years to come will play a huge role in taking healthcare deliveries to the tier 2 and tier 3 cities much more than it is today. So I think these are three big things from my perspective.
Sure, sure. Thank you, thank you. Dr. Sunil, I want to come to you because we are hearing that technology is getting easier for healthcare professionals. Now, from Yashoda Hospital's point of view, since you're dealing with your doctors and how easy technology is for them, please throw some light on the practical challenges and what are you doing to upskill doctors to be able to deal with what technology throws up to them on a daily basis.
Yeah. Am I audible, I think? Yeah. Thank you so much for the opportunity. So from a hospital perspective, or I would say from the management's perspective, when we are in the process of acquiring technology, one of the biggest stakeholder in this whole process is the clinicians who are supposed to work upon all those technologies, the medical technology equipment. So the best thing is to make them understand whenever there is a new acquisition which is happening, to make them participate in that whole process equally, right from the ground zero when we are creating that vision of getting that equipment or technology within your institution. And then thereafter, the second, once they realize that yes, this is the need of the hour, and if we see it from the perspective of MVT, technology acquisition has actually fueled the whole transformation of MVT, particularly for our country. So when we make them understand and take them on board to understand this need, the next level would be to engage them into a training program, particularly for that technology or the equipment. And thereafter, the thing which comes in once they are trained, now they have to realize, or they have to be made understand that once this equipment has been made on board with the institution, the upskilling should happen as a regular process. It's not something that once you are trained, you are done. Because there will be innovations and evolutions within that equipment. So every day or the other, they have to learn the things. They have to work on their reflexes with regards to that technology or the equipment. So this is how we can engage them, and moving ahead, once they work upon the patients with this technology, we actually get into a process wherein we tend to makeshift the whole of the clinical outcomes.
Sure, thank you. And thank you, panel members. I think you've been very precise in answering questions. Thank you. It's been very enriching to understand. I'll request Dr. Sharad Kumar Agarwal to summarize what has come out of this session and give his closing remarks. Dr. Agarwal.
Thank you, Sumit. So it's a wonderful discussion. Everybody has touched the one dimension of the value of the medical technology in the medical value travel. So, see, there is an unprecedented industrial growth in India. Following liberalization of economy, Indian healthcare system is also seeing a sea change with improved health parameters, increasing manpower and infrastructure, and improved healthcare funding. Advancement in technology used in healthcare has enhanced the quality of healthcare delivery, thereby resulting in better clinical outcome. Along with advancement and innovation in medical devices, the quality of services is also improving to match the global standards. There is an increasing demand for high performance medical devices both at home, in the hospital facility, that are easy to handle, precise in identifying the problem and providing the accurate treatment to the patients. Indian healthcare industry is witnessing a double-digit growth for the past few years. Definitely this growth is fueled by demand from major cities. India has the best of the healthcare delivery system, attracting medical tourists from all over the world. Medical value travel, which is worth 7,400 million USD in 2022 is projected to become 42,237 million USD in 2032. Medical value travel of India accounts for 20% of global market share. India is becoming a medical tourism destination due to various reasons. The cost of treatment when compared to the first world country, it is less in India. Accessibility to the medical care is fast and procedure can be undertaken immediately. There is no waiting time. World-class and standardized medical services are available, and the hospital India have acquired state-of-art equipment. India also provides opportunity to the medical tourists to visit some of the most alluring and inspiring places by taking them on a medical tourist trip. Hospitals in India have acquired state-of-art equipment, robotic surgery, high-definition imaging, advanced cancer treatment, gamma knife, stereotactic radiosurgeries, high-resolution endoscope, air ambulance, therapeutic devices such as pacemaker, artificial joints, hearing aids, diagnostic devices such as blood glucose monitors, pregnancy tests, advanced hemostats, and wound care devices are available in many centers. Artificial intelligence in healthcare, telemedicine, 3D printing, etc. They are being increasingly used. Currently, the market for medical technology in India is small, but is expanding rapidly. Imports constitute 75% of medical devices market. Affordability, accessibility, awareness, and availability are some of the key factors to increase penetration of medical technology uniformly across India. Indigenous manufacturing must be increased to substantial level to reduce healthcare costs and improve medical technology penetration. Innovation are the key to achieve our goal of indigenous development of medical device technology. The medical device sector in India has the potential to deliver tremendous growth to the country economies. As per estimate, the sector is expected to grow at 28% per annum to reach a size of 50 billion USD by 2030. Healthcare industry in India is witnessing a rapid growth of innovation marked by an entry of foreign investor, disruptive healthcare models, frugal innovations, digital revolution, and the shift from product innovation to process innovation. It is a collective challenge and an opportunity for us to embrace innovation and incorporate sound investment strategies while prioritizing patient experience. Of the various innovation model, frugal innovation will be key to offering quality healthcare at a much more affordable price. Availability of high-skilled manpower is definitely advantageous in our country. Recently introduced regulation like medical devices rules and policy for R&D in medical device technology will help to bring favorable environment for development of medical device technology in our country. At the same time, we should also realize the fact about abundant talent available in India, as our moderator was discussing the capacity building and scale up, who are in demand worldwide. Therefore, India has 10% cost compared to the first world countries with the same quality outcome. It depends on training and skill in medical education by which one graduated or post-graduated and developed a perfect clinical acumen to use the devices rather than depend on the devices. My one advice to all is that in our country like us, we should also make balanced and judicious approach in promoting devices for those who can afford the cost. As more the devices depend treatment, more is the cost, and should make our clinical sense alive. The only reason why our clinician being considered the best across the world, and we provide it for decades, and recently our clinical superiority got appraisal and a lot of laurels we got due to COVID management. It is all because of the clinical sense, the clinical superiority. So I always believe, yes, technology is good for the patient outcome, but yes, we should be cautious. We should use technology to assist us. We should not be dependent on the technology. And probably that is the difference in the clinicians of India and the other world. With these words, I thank you all for wonderful discussion and output. Thank you.
Thank you everyone once again to all the panelists, our moderator, chair and co-chair for taking out time for this interesting panel discussion over here. And like they mentioned, indeed with this we've come to the end of day one over here. It has been an enriching and fulfilling day for all of us, filled with so many life stories, anecdotes, hope, innovations, advancements, technology. And I'm looking forward to see you all tomorrow once again. Thank you so much, everybody who's taken out time. Can we have a huge round of applause for each one of you present over here for making the entire day, all these sessions so interactive and interesting. Thank you. Please have a good evening. Take care.